Good morning, everybody. Croeso, Bwrdd. Welcome to today's Digital Health and Care Wales board meeting. A little bit of sadness for me today because it's actually my last meeting as interim chair of DHCW. I'll come back to that in my chair's report a little bit later. First of all, I'd like to extend a very warm welcome to all board members and all those members of the public who are tuned into our live streaming board meeting today. I'd also like in particular to welcome David Murphy from Audit Wales. David's observing today's meeting as part of the Audit Wales baseline governance review work that they will do with a new organisation as it comes into being, like DHCW. And I had the opportunity for a long conversation with David earlier this week. And I would also like to extend a very warm welcome to Simon Jones. Simon is also attending today's board meeting to observe, but Simon will be taking over from me as chair of Digital Health and Care Wales from tomorrow, the 1st of October. And again, I will come back to that in my chair's report a little later. So a warm welcome to David and Simon who are joining us today. Again, for those members of the public and our stakeholders who are joining us, just to remind people that due to the continuing restrictions around COVID-19 and Welsh Government advice to work from home where possible, we are continuing to hold our board meetings virtually, certainly for the time being. But continuing to broadcast our meeting live, giving everybody who has an internet connection the opportunity to join in our meetings, and that's something that we've shared through various channels prior to the meeting today. So we continue to try and make these meetings as accessible as possible for people. In addition, remind people that as well as the being able to watch the live stream today, a recording of this meeting will be posted on the Digital Health and Care Wales website. So if anybody can't observe the meeting today or observe the full meeting, you'll be able to catch up on that by clicking on the YouTube posting on our website after the meeting's concluded. And it's good to see actually that we are getting quite a lot of people going back and picking up on the recordings, either in total or in part, in terms of the recordings of our formal public board meetings. I am also expecting a number of our stakeholder colleagues to join the meeting today as observers via the live stream, which is great. And again, can I extend a warm welcome to all of those all those of you who may be observing our meeting today, or indeed watch the meeting after it is concluded. Just in relation to today's proceedings, again, just a couple of things to note about the conduct of the meeting. Those who are watching will note that either myself or board members are not always looking at the camera, and my apologies for that, but it is essential obviously to be able to read papers at the same time as taking part in the discussion on the camera, so you won't always have eye contact with us. And we will be taking at least a couple of breaks during the course of the meeting today. They're scheduled at the moment for after parts 4 and 5 of the agenda, but I will be flexible according to how time goes if we need to take an additional break. The aim is that the meeting will be concluded by 2 p.m. at the absolute latest. I'm hoping that we will get through our agenda more quickly than that, but that's the broad time frame for today. Okay, that's my sort of preamble, my opening remarks. Moving on to the agenda for today, then, as is practice now for our board meetings, we have the first part of the agenda, which is the consent agenda, and board members will be aware that questions on the consent agenda have been sought in advance of the meeting and addressed by the relevant officer lead. It's not normal for me to go through those prior to the meeting starting today. They will be shared separately on the admin control system. But it is just a brief opportunity to see if there is anything that is on the consent agenda that any board member thinks needs to be moved to our main agenda before I move us on to the main agenda. If I can just pause at that point. Okay, So I'm not getting anybody saying there's anything they think we should move to the main agenda. In that case, I'll move us on to the formal part of our agenda today. Firstly, apologies for absence. We just have the one today, which is from Andrew Fletcher, who is our associated board member from the trade unions. Andrew is on leave this week and is unable to join us. In terms of declaration of interest, I've not been notified of any conflicts of interest by board members prior to the meeting. Again, I will just pause to see if there's anything that anybody needs to raise before we move into the body of the agenda. No? Okay, there are no matters arising from the previous minutes. If I can move us on, therefore, to the consent agenda. And we do this, as we said before, to ensure that we focus on the business critical activity during our board meetings. I'm assuming that everybody has read all of the papers under the consent section, and we've already gone through the point that there's nothing that we need to move to the main agenda. So if I can just run through then for the formal record, to note that we are under the consent agenda, we are formally approving the minutes, which is item 2.1 from the last board meeting on the 29th of July. We're noting the action log 2.2. All the actions have been updated and marked as complete, including those actions that were raised at the last board meeting on the 29th. We're noting the contents of the forward plan, which we review on a regular basis. So that sets out the items scheduled to come to future board meetings. And in terms of specific decisions, we're approving the NHS Wales National Clinical Audit and Outcome Review Plan, item 2.4, and in so doing, the board is approving Digital Health and Care Wales acting as joint data controller with the Healthcare Quality Improvement Partnership for the delivery of any project commissioned by the partnership as part of the National Clinical Audit and Patient Outcomes Programme. This approach has already been through our Digital Governance and Safety Committee, who've endorsed that approach, and therefore the board is effectively ratifying that decision today. If there's no further comment on the consent agenda, I will now move us on to the section 3 on our main agenda. And as again is becoming practice for our board meetings, the first item on the agenda is, as part of our organisational learning approach, a patient or a user or a staff story to help connect the board to the work that we do and the impact that it has and so on. So it's my pleasure to welcome this as the second story to the board today. And I'm going to invite Rydian Hurl, our medical director, to introduce today's item, and colleagues who will present and take us through the story. And when we've completed, we will open that up for questions from board members. So Rydian, without further ado, can I hand over to you to introduce the item and to introduce the colleagues you've got with you? Thank you.
Thank you very much, Chair. Well, look, I'm delighted to introduce Gillian and the team. This has been an exemplary programme in many ways. I think it's worth us considering that the pandemic continues. When we put the retrospectoscope on what we did when we did it, which will inevitably happen, we have to consider the context at the time of the challenge being put to us as an organisation and the uncertainty at that period. This story is about a team of 10 brave individuals who've worked tirelessly to support all Wales delivery of vaccines. I dare say many of you will have been touched directly by this service that has been supported by us across many care contexts across Wales. So this is a story about how that team has risen to the challenge, how they've adapted systems building on the previous investments that have been put in through our previous organisation. This is also about agile development and taking Wales to the top of the world rankings. And so that's something we can smile about and be proud about. I hope you enjoy the story, and I'll hand over to Gillian.
Thanks very much, Rydian. Good morning, everybody. My name's Jill Davison. I look after the community applications team within the operational application directorate within DHCW. I'm here today to talk about the WIS system, which is the Welsh immunisation system, which we delivered only back in December, I think the 2nd or 5th even, last year. This system was rolled out at pace to support the national COVID vaccination programme as the latter part of last year. I'm also joined today by Grant Davis, who's a Health Board programme lead in Aneurin Bevan, who's going to reflect on his thoughts from a Health Board perspective with regard to the system that we delivered. Next slide, please. Okay, our organisation was asked to support the vaccine programme in Wales by delivering a digital solution back just August actually last year. It feels a lot longer, but it was August last year when the COVID vaccines were on the horizon. People were talking about the vaccines coming to provide hope to us all, I think. At that time, my team were completing our rollout of the new child health system, which is called Cyprus. This system has been used over many years as the national system for Wales, and it was also used in England for lots of areas of England for a period of time to deliver aspects of child health services from birth to 18 years of age. At the core of that system is immunisations. So preschool and school immunisations. For any of you that have got children, you realise how large a schedule that is. So hence leveraging the team knowledge of child health and the system components that we've already developed for child health, it provide the perfect choice really for us to say this is the way to go and to leverage everything we've done for child health. It wasn't just about the system, it was about the business knowledge as well. The concepts were familiar to the team members. There's a number of people in the team who've worked in child health for, including myself, for more years than I care to remember. So we had a head start really in terms of understanding the requirements for an immunisation system. Saying that, the COVID immunisation system or the requirement for the mass programme was going to be quite a lot different than the child health one, but obviously we could relate to it. Delivering the system that was fit for purpose was going to be difficult. The variables themselves in the programme were changing quickly. For example, the vaccine name, I think, changed about 3 or 4 times in the first month or 6 weeks. So that was pretty difficult to manage. The start date of the programme changed when the first vaccine was going to be put into the first person. That changed considerably. So it was quite difficult to manage. But at the end of it, the first system was delivered approximately 6 weeks, within 16 weeks, sorry, from start to finish, which is a massive achievement. I mean, we're talking about the design, the requirements, the technical development of it, the testing of it, the implementation. I could go on. So 16 weeks isn't a long time. So it was a big achievement. A year has now gone past since the start of the campaign, and during that year, there's been endless work by the NHS Wales vaccines teams across the board, including our 7 health boards, to ensure that we're all delivering in line with the overall vaccine strategies as they become refreshed. I think there's been 4 strategy versions up until to date because it is quite fast-paced. The health boards themselves have had to operate on a fluid basis with their operational plans, and there's been many curveballs that have been thrown in our way. But together, a credit to all of NHS Wales that all the milestones have been met, and we have actually been considered the best in the world for the delivery of the vaccines, which is amazing. I know myself and my team really feel very privileged to be part of what we call the vaccine team Cymru. Next slide, please. In terms of what Wiz offers, as a summary, really, we've got two offerings of Wiz. So two systems were delivered in 16 weeks. Together, they offer the core functionality of a vaccine programme or vaccine information system. In terms of the point of care device, which is a brand new system, it's the one that you've probably seen in the mass centres or the immunisation locations if you've been for a vaccine. It'll provide a list of people that are expected or unexpected. It will also allow the vaccinator to check things such as what vaccinations have been given in a GP, what allergies the individual has got, and prompt the vaccinator for eligibility questions, consent questions before the actual vaccine is given. One of the design choices was to ensure that the system was quick to input because the throughput was going to be quite large. Everybody was expected to be offered a vaccine. So that was very much in the forefront of our minds. Things such as adverse reactions can be recorded as well at the time of the vaccine or up to 15 minutes of the individual being in the mass centre. The system, the point of care system with Web it also offers pharmacy teams, stock management facilities, which was built in on request of the chief pharmacist in Welsh Government. This would allow delivery records, stock records, checks of temperature, because as some of you may be aware, the Pfizer vaccine, for example, has got to be stored at -70 degrees, and there's got to be constant checks on that throughout. Wiz Core, which is the other part of the Wiz system, does more of the heavy duty tasks. So it's a desktop application. It does things such as the automatic appointment scheduling, the session management for the health boards or primary care. Central to Wiz, so those two front ends, but central to it is a population register, which we refresh now and again so that we ensure that the vaccine gets to the right person at the right time. So Wiz operates off this population register, which is based on GP registrations to ensure that, as I say, that the right person gets the right vaccine at the right time based on the Joint Committee of Vaccinations and Immunisations advice at that time. We also offer a centralised service for Wales. We realised early in the campaign that because of the timelines, it was going to be difficult for health boards to go their own way, if you like, for running appointments, running their own letters, running text services. So we decided that we would centralise that. And today we run all appointments on behalf of all Wales within DHCW. And it's obviously quite a busy process, especially now when we've got boosters on the cards. So we run thousands and thousands of appointments for the citizens of Wales. The letter service, we looked for a third-party supplier to help us with that in terms of the printing and the posting. We got that on board pretty quick, and it was ready for service for the first version of Wiz that went out in December. In terms of integrations with the Wiz system itself, they've been built up over time. We've got cross-border integrations with England, so any Welsh residents or Welsh registered citizens that have been vaccinated in England will automatically be uploaded into Wiz to form part of the complete clinical record on Wiz, and vice versa. So any English residents or English registered individuals will be, the vaccine details will be sent to England as well on an overnight basis. We've also got integrations with the GP systems in Wales, Vision and EMIS. We are live with Vision, and we're still in a piloting process with EMIS, so that any completed vaccine details get sent to the GP system on a regular basis. Another flow out of Wiz is the Welsh Pandemic Record for the purposes of certification. So citizens, as you may be aware, are able to apply for domestic and travel certificates, and all the data has come from Wiz. We also send 4 times a day data from Wiz, which has been collected as people are vaccinated, to our data warehouse, so that the information team within DHCW can do any national reporting. Health boards can use it for planning purposes, and Public Health Wales can use it for surveillance uptake purposes. So it's near real-time data being available for reporting across Wales. Next slide, please. In terms of the major constraints at the beginning of the project, I suppose it's the normal constraints, but these were sort of manifested big time. The requirements and the scope, there wasn't time to formalise all the requirements in a traditional sense of the word. My team basically came up with the core requirements based on what a Child Health did for immunisations, and we built upon it. It was a very evolutionary phase. We built upon the core requirements in an iterative way. Our vision for the first release, or if you like, the minimal viable product, did get built upon quickly. So things like centralisation of appointments, for example, even though they weren't planned for the MVP, we soon realised that we had to put them in. So the first release had a larger scope than we envisaged from day one. In terms of timescales, it wasn't not just the short delivery time, but it also was problematic because it changed several times during that early period. So planning needed to be very flexible and adaptable. So that we stopped implementations at the last minute, and then we had another week or so to work on the delivery. So that was pretty difficult. The resource inside of it, as always, that is a difficult thing, but for this project particularly difficult because we didn't have time to upskill new resources. So we had to organise ourselves in the best way possible to maximise not just the development aspects, but also the support aspects of the system. So team members had to do jobs they normally probably wouldn't do, but we organised ourselves, and it was all hands to the deck basically. And I can't underestimate the massive team spirit that went into this to be able to deliver and keep delivering the WIS releases as we go through. Next slide, please. So in terms of the journey from start to today, as I mentioned, August last year was when we were starting to look at delivering an immunisation system. This slide shows how many vaccines were given in that period of time. So December the 7th was our first release. We actually did another release during December as well, which is why that +1 is there. We've basically delivered 20 releases since December, 10 of WIS Web and 10 of WIS Core, which is a huge number of releases to keep up pace really with the vaccine programme itself and the changes that come about. Next slide, please. As you can see as well from that slide, the text reminder services that we delivered as well as part of the April release. We're sending booking reminders with 24-hour reminders, 72-hour reminders. During that April release as well, there was a new vaccine that came on board, Moderna, so we had to adapt the system for that. We onboarded GPs and community pharmacies practically overnight, which was the big challenge, which did cause us some issues with performance on the system. We were lucky that we've got great colleagues in DHCW, especially the infrastructure team, which we could call upon to help us in that difficult period of performance issues. And we all worked together to overcome that in a short space of time during February. Next slide, please. As you could see, the key functionality that was delivered throughout this release is shown on this slide. Other things to note, in July, we took on board trial participant data because at that time it was not in WIS, and obviously for purposes of boosters and have vaccinations, ongoing vaccinations, that data was uploaded into WIS. In August, we delivered the booster-enabled version of WIS. That was done prior to the actual confirmation of the booster programme. We found as we've gone along, because there is decisions made at last minute about vaccines, we have to make the system very flexible and offer give ourselves our ability to configure the system so that we can tailor it for different scenarios. So for boosters, for example, we were planning on 3 different scenarios being confirmed. So we had to plan for that in WIS, and then when we were given the firm plan of the boosters, we configured WIS literally on a day, ready for delivery of the first booster. We delivered the last version of WIS only a couple of weeks ago. That was alongside the booster enablement. It was to deliver flu as well. So flu may be co-administered with the booster. So we've enabled WIS to do that. And as a benefit of WISWeb as well to our child health programme, we've been able to, with minor changes, offer WISWeb to be used in schools for delivery of the school vaccine, which is the school flu vaccine, because the cohorts this year have doubled since last year. So that's going to be a great help for school flu as well as a flu alongside the boosters. The last piece of work that we've been doing this month really is the two-way texting enablement. So to provide citizens with the ability to change their appointments via text. So if they want to change the date and time of appointment, the text message will enable them to do that in a simple way by just saying option 1, I want to change my appointment. It'll go back to WIS. WIS will offer 2 or 3 alternatives and the individual can change the appointment very straightforwardly. So in terms of what's next on the agenda for WIS, number 1 priority now is to provide an online booking solution. This will be booking solution so that citizens can go on a website and safely book their appointment or rebook an appointment they've already got. They'll also be able to see their demographic information and their vaccine information. So that's what we're ploughing on with ASAP, and that is our top priority. Next slide, please. This slide just illustrates the numbers that we're talking about in terms of letters that we've sent. As you could see, 3.3 million, the number of GP surgeries that were implemented overnight, and text messages that we've sent. And these are all things that have been done centrally from DHCW premises. Next slide, please. In terms of first doses, second doses, I think that second dose is slightly out to date, but first doses, I think as of today is 2.4 million, second doses 2.2 million, and total vaccinations are 4.7 million. So obviously figures change daily. I think boosters, today's figures that have gone in since the beginning of the booster campaign is 72,000. So that is going up and up every day. Next slide, please. And I would like to ask Grant Davis, who's Programme Lead in an IMTP, to share his reflection on the programme.
Hi everybody. Thank you, and thank you, Jill. Yeah, as Jill said, my name's Grant Davis. I'm the head of planning and performance for the Aneurin-Bevan mass vaccination programme. I've been involved with the programme in one form or another for close to 15 months now, so pretty much from the get-go. And I've been asked to speak today and just give some general feedback on the Welsh immunisation system, or WIS, from a health board perspective. So it is fair to say that my health board had some initial concerns over WIS, which I would say were predominantly driven by almost the disbelief that something so complicated could be developed in such a short space of time. As Jill had initially alluded to, I think we were talking about 16 weeks. So as a programme, we had a contingency in place, and I will hold my hands up and say that in an IMBEV, and I think most of us believed that that contingency was going to be required. However, I am happy to say that we were proved wrong. We were proved very wrong. So WIS, for me and my colleagues, was a complete game changer, a paradigm shift really in the ability to deliver such a complex programme at such scale and pace. In my role and for my counterparts in other health boards, we're ultimately responsible for ensuring that multiple offers of vaccinations are made to a whole population equitably within set criteria and set timeframes, needing to consider numerous risks and age factors across multiple sites, now integrating 4 different phases of the vaccination course, and ensuring that each vaccination is recorded accurately, which enables additional scheduling in line with intervals that are set and sometimes amended by the JCVI. Without the Welsh immunisation system, that would have been extremely challenging, if not impossible. I would lean more toward the latter, in my opinion. And not only the development of the system that has been so critical to the success of the programme in Wales, but also how it's adapted and evolved again over such a short space of time based on user needs, feedback, and as Jill has alluded to, we have dealt with many in-flight changes, and again, the adaptability that the system and the colleagues who are in charge of developing the system have shown has been unbelievable, and it's just so incredibly impressive. The product that has been provided to the users has been 5-star without a doubt. I do want to mention Jill and her team. Myself, I've dealt with Huel Williams, but I know Jill has more people in her team at DHCW. Apologies. Their dedication and ability through the whole time from the initial planning stages to what is now a booster or 3rd dose phase has been incomparable to anything I've ever experienced with partnership working. No matter what time or what day, weekend, evening, somebody from the team has been there to help talk through problems, resolve issues. The team have been a huge credit to DHCW, the NHS and the residents of Wales, and deserve all the plaudits they will get. So thank you. It's very brief, but hopefully I've got my message across. So finally, just on behalf of Aneurin Bevan, and I'm sure other health boards in Wales, I would like to thank everybody that's been involved in the development of this system, because as I said, and I will say it again because it's not an understatement, it has been a paradigm shift and critical to the success of this programme in Wales. Okay, that's it. Thank you.
Thank you, Grant.
Thanks, Grant. I think we're going to play a short video now, which was by one of our business continuity team going out to Cwmtaf, and it's the view of a vaccinator in Cwmtaf.
I'm not sure we've got sound on the video. I think Jenny Lee's just sorting that, I think. Can you enjoy? And give it one more go, and if not, we'll have to move on.
coming in.
I'm an immunisation nurse.
Excellent, thank you.
For Cwmtaf Morgannwg Health Board. I've been 31 years nursing, but predominantly working out of Royal Glamorgan, and more recently then working with the specialist IMS team since last September, which I absolutely love doing. The Welsh immunisation system is a computer system that allows us to, at the moment, put all the COVID vaccines that we're doing in one place. So we've got a handy record of whether they've had their first or their second, and it doesn't matter where in Wales that they had their first one, we can still see all the details and then safely deliver the vaccine. So without the Welsh immunisation system, my job would have been much more difficult. It has saved me a lot of time, a lot of legwork, a lot of effort in order to find out just the simple details that sometimes they're a bit more complex, but we can do it there and then on the spot, just going into the one system, searching everything. We're not turning these patients away, which I imagine without WIS we would be turning people away. So it's made my job much more efficient. And I suspect that's why Wales is world leading now in the vaccination programme.
Okay, great. Thank you. Okay, as Lois from she's Deputy Chief Pharmaceutical Lead in Welsh Government's put this slide together. Unfortunately, she couldn't come today. So in summary, I think I mentioned before, we worked with pharmacy colleagues, including Andrew Evans and Lois, to put in some pharmacy functionality within WISWeb on day one, which allowed them to keep track of vaccine, ensure they could monitor wastage, fridge temperatures, etc. We also provided them with some ad hoc reporting support as well on a nightly basis, very late at night, which basically helped them to basically allow them to track wastage and to make sure that vaccine was used as quickly as possible. I think a key factor in the vaccine success in Wales was the ability to put vaccine in arms as quick as possible rather than storing it, and also to minimise waste. And I think they'd be the first to admit that that was achieved big time really, and WIS helped them do that by allowing them to record the information and reporting on it on a daily basis. Next slide, please. So this was the BBC headline at the time, how Wales was leading the UK. I think we overtook Israel at one point, which use a similar system, I think. But yeah, near live vaccine data and intelligence, as I've said before, when the vaccine goes in, it's basically 4 hours later, it will appear in dashboards and be available to Public Health Wales. And the ability that it's a national one-off system obviously makes that easy. We've got various complex session abilities within WIS, like Grant said, to cope with all the variables really about that the vaccine programme brings and will continue to bring, I'm sure. So it allows us to make sure that the right person is offered the vaccine at the right time based on need as well. In terms of the scheduling side of it, we obviously operated that as quick as possible because we knew that that would be a core part of the delivery. I know Grant alluded to it at the beginning. Some people were quite sceptical at the beginning of the programme in terms of our auto scheduling of appointments. So at the press of a button, we can generate thousands and thousands of appointments rather than manage one by one. I think that is part of the success of this story really, because without that functionality, it would have been too time consuming for health boards to meet those milestones. good relationship with health boards beyond doubt. They've been brilliant, and we've worked with them every step of the way. And I think, as well as Grant saying, we've been here day and night. I think health boards have as well, and we've supported each other through good and bad times, I think, through the vaccine programme. Next slide, please. So in terms of my view of what the major contributions to the success of it was, one common goal that is across NHS Wales generally, all of us are in it together. I mean, it's a pandemic, and to be part of something that could help, I think that drove us all on, and we were all wanting it to be a success. So we worked together brilliantly. Clinical advice was always on hand. Dr. Richard Roberts from Public Health Wales, who's just recently retired, who we've known through Child Health for a number of years. He was always available to provide advice, give us heads up about stuff as quick as it was possible. Within our organisation, Anne-Marie Cunningham, who's the GP as well, she was always on hand to investigate and give us advice about anything that we weren't sure about. And even Welsh Government, senior responsible officers, etc. in Welsh Government were always there for us to ask questions of. I think for me, providing a service, not only a product, is very key. We do obviously provide operational services across the board. I think for this one, we just needed to go a step further, and to make sure that we provided as much support and we turned around queries as quick as possible, so that we weren't the blocking issue for health boards or anybody to progress with the vaccines. Always agile working, agile across the board for all of us really. Rapid response to any feedback that we got. And my team were suitable for a project of this type, being invested in child health for a long time, and being already agile enabled in lots of ways. We were able to, for example, ensure that people immunosuppressed recently got a third dose before a booster. That was turned around probably in about a week, which is quite unbelievable, really. And it's always got to be a Saturday that Wiz has got to be put out, because we can't interrupt business. So it's always like midnight on a Saturday. So that's our Saturday night out, really, twice every month, I think, for the last year. So I think I've touched on most of this before, but I think, it says for itself what we've achieved really with Wiz. Next slide. And that's it. So questions really now.
Jill, can I thank you, Jill? Thank you, and Grant as well, for sharing that experience with us. That was a fabulous presentation, and I think that last slide in particular was very welcome in sort of capturing the generic learning that's come from everything that you've been through over these last few months, or last year or so, I should say. So thank you for that. I will take time for a few questions. I think I've got 3 questions lined up in the chat bar. Sian, can I go to you first? Sian Doyle.
Jill and the team, you must be delighted to have headlines like that for Wales. So that says it all, I think, and exactly what we should be aiming for as DHCW. So thank you. Question for me, Jill. What are if you had to give the teams now going forward, the 3 big learnings on what we keep in what we do and what's changed, what would you take forward? Because clearly this was an amazing programme and quite unique, but there must be some learnings from this that we can take into future projects and best practice.
Yeah, I think from a obviously development perspective, which is really my bag mainly, it is the agile approach. We've got to be able to have an iterative approach of delivering, and so that our customers and stakeholders can see what we're doing early on, rather than waiting for a long period of time. I think that's the main thing, but I think as well the customer focus as well, part of it. we're very much customer focused in my team, and I'm sure other teams are as well. But that really drove the success of it as well, because it was a shared listening game, really, because we were all learning as we went along. We were all in the same boat. Curveballs were thrown at us, curveballs were thrown everywhere, and I think it's just about collaborative working, really, and being agile in terms of development.
Well, congratulations and thank you, Jill. Thank you, Chair.
Thank you, Sian, and for those responses, Jill. I think I've got Rowan next. Yes, there's Rowan.
Thank you, Chair. Gillian, I just want to say a huge thank you to your team. I don't benefit from your systems. I live in England, but my parents certainly did, and Grant, a lot of my family are customers of Aneurin Bevan, so thank you very much for everything you've done. I just wanted to take a moment to also reflect on what you've done for the business case for DHCW, because you were doing all this while we were transferring from NWIS to DHCW. So I think that is something we should all acknowledge. That must have been very difficult. But also because this is a powerful exemplar of how digital health can impact healthcare delivery in Wales. So, the added value that this phenomenal project has really delivered for us. You've got additional return on investment now, because we now have something we can roll out for seasonal flu vaccines going forward. We've also learned through this, I think, how to engage with the public digitally in terms of appointments, and I think that's incredibly useful, something that we can build on in the future. I think, whilst all this was going on, obviously the pandemic has put a huge focus on virology as a clinical and a primary science discipline. And there's a growing body of evidence in the scientific literature that viral infection is a driver of downstream chronic disease. So the fact that Wales has been able to achieve such a successful vaccine rollout will have a consequence and a lowering of chronic disease for the next couple of decades, and that is something that you should take pride in, that, because it's absolutely consistent with delivering the Healthier Wales strategy. So I just wanted to say thank you, Gillian, and just put that on the record as well. So thank you very much.
Thank you.
No, thank you, Rowan. Some really important comments there, I think. I'll take one final question from Marion, and then we'll draw this to a close. Marion?
Diolch Cadeirydd, thank you, Chair, and thank you for such an inspirational presentation, Gillian and Grant. Really enjoyed it. It's such an impressive achievement, and building really on the comments made already by Sian and Rowan, an electronic vaccination system for the whole of Wales in such a challenging timeline and context. You've helpfully highlighted those contributions to success factors, and it's been really good to hear that practical feedback from some of our users as well, pharmacists in particular. And I guess I'm turning to the future again, and my question probably is specifically one for Hydian, and in terms of the lessons learnt. You talked about the game changer that we have here, and you've talked about the importance of collaboration, agility, and that importance of being of having focus on the customer. So I guess my question, Hydian, turning to the future, is how can we and how are we going to ensure that these principles are applied to all our projects in future?
Thank you, Marion. Well, demonstrating collaborative working through the governance structures across Wales is key to changing the way that we deliver. The governance structures, including digital services for public and patients, will be key. Our engagement with that will get us to a position that hopefully we can understand what the requirements are of the users in terms of the citizens in Wales, their health needs, both in acute situations, but also in the self-management of chronic disease, and that fits in with strategy policy of a healthier Wales, etc. As regards to the relationships with the health boards, through yourselves having independent members, we have an opportunity to build social capital across different pathways, which is will be very welcomed, and I'm sure you'll be excellent at it, particularly in the North Wales corridor as we work with colleagues up there. So the opportunities that come from this sort of programme that demonstrates what can be done when the whole of Wales pushed together for Wales to deliver an all Wales programme has demonstrated that we are a key stakeholder amongst many in delivering successful programmes in a digital world.
Diolch, Diana. Thank you, Chair. Diolch.
Thank you, Rydian, and thank you, colleagues, for the questions. Just for me, really, just to sort of close the session again, Gillian, to thank you and to thank Grant for the presentation today. It really was fantastic. I think it's one that we all can relate to because we've all had those experiences. And as Rome was reflecting on her experiences, I was reflecting on my family's experiences because I've got 3 adult kids, and I think the vaccine records are made up of people having vaccines in Cardiff, Newport, Manchester, Cambridge and London, I think I'm right in saying. And if it wasn't for the kind of systems that have been put in place, that wouldn't have been possible in terms of stuff moving through the system. So from a personal point of view, thank you too. And I agree, it was an inspirational story, and perhaps most importantly, those generic lessons that you've been drawing out there are really important in terms of future projects. So thank you again for that. Okay, I'm going to move us on, folks. I'm going to try and stick to the break we've got planned at the end of part 4 of the agenda. So I will try and be fairly quick through my chair's report, and then I'll hand on to Helen shortly for her chief executive's report before we take a short comfort break. So if I can just turn now to my report, a few things I just wanted to highlight. One thing, just a piece of formality really, was for the board to ratify the use of the common seal, which was applied since the last board meeting in relation to 2 deeds of variation and a rent review memoranda. So this is just a formality that we go through where the legal documents are signed using the formal board seal. It's the first time that we've done it. It was worthy of a public photo for Helen. So I was pleased to do that. So can I assume, colleagues, that you're content to approve the use of the common seal in that area? Not seeing anybody say nay, so I'll move on. If I can then come back to, I think, where I started the meeting today, which was to formally be able to confirm that after a successful public recruitment campaign, which was done through the public bodies unit of Welsh Government, that Simon Jones has been appointed as the new chair, the first substantive chair of Digital Health and Care Wales, with effect from the 1st of October. And as you're aware, Simon is observing the meeting today. So Simon, welcome again, and my congratulations to you on your appointment. I have known Simon off and on in professional capacity for quite a number of years, and I feel really confident in knowing that the new board is in very safe hands. Simon's tenure will run for 4 years up until the 30th of September 2025. From my point of view, as interim chair, it's been an absolute pleasure to have overseen the transition of staff and functions from the NHS Wales Informatics Service, NWIS, to the newly established Digital Health and Care Wales Special Health Authority. And that, of course, has included the appointment of the board of independent members and executive members who are making up the board as we meet today. But as I say, Simon will bring to this in future a vast array of experience, board level experience in the NHS, public and third and private sector experience as well. So I would just like to wish Simon and DHCW every success for the future. I'm confident that the board will continue to drive digital transformation in Health and Care Wales, as we've just seen from that last example in terms of the WIS system. In terms of other issues, just to touch on, there has been in the last month the latest of the regular chairs meetings with the minister. So that last meeting took place with Eleanor Morgan on the 16th of September. I was unable to attend on that day, so I'm grateful to Ruth Glazard, our vice chair, who attended on my behalf. And as ever, those meetings are quite wide-ranging, a number of topics covered, but in particular the current pressures faced by the health and care system around recovery and plans for moving forward. I would also like to note that as part of our wider engagement work and the relationship building that we've been doing across the system, in July we started a series of initial board-to-board introductory meetings with other NHS bodies, and we're partway through that programme now. That really is about establishing the relationships and DHCW's position as a member of the NHS Wales family and amongst the other 11 organisations. And I'm very grateful to colleagues from the other boards and trusts that we've met with, because I think off the top of my head, in recent months we've met with Hywel Dda, we've met with IMTP, we've met with Velindre, Health Education and Improvement Wales, and I think our most recent was with Welsh Ambulance Services Trust. So we're getting through those at a rate of knots. I'd also just like to note that the board development session on the 2nd of September took place, and I think it was a really important meeting because in many ways it felt like, well, there was two reasons why I think it was important. One was because we did actually, for that meeting, move to a hybrid model where we were able to meet appropriately distanced and so on and so forth, actually in person, though some colleagues joined us online as well. And that was particularly good. I think it was the first opportunity that we've had as a board for most of us anyway, to meet face to face, and that does feel different, and I think points to the future in terms of how we move to different models of board working. So it was important for that, but also I think it felt to me like it was marking a turning point for the board in terms of moving away from the focus that we've had very much on establishment, getting the governance in place, getting key appointments made, and beginning to do what the board is really here to do, which is to think long term, thinking about the future, begin that process of thinking about strategy. So we were exploring a number of critical areas in that board meeting. We actually had Health Education and Improvement Wales joined us, Chris Jones and Alex Howells, to share with us the journey they've been through over the last 2 to 3 years as another special health authority, and that was really informative and helpful, and indeed they will be a key partner for us moving forward. We had a good conversation about risk. We've been doing a lot of work behind the scenes on our risk management strategy, but also what we call the risk appetite, the general approach of the board to how we view and manage and mitigate risks. Perhaps most importantly, we began the conversation about core purpose, mission of this organisation. It's the start of the strategic conversation really for the new board, which I think will be a major part of the board's activity over the next 3 to 6 months as we move into the next phase of the planning cycle around the development of the next 3-year integrated medium-term plan for DHCW, and it really is important that for the first time that the new board has a real opportunity to shape that process. So that was a really enjoyable development day, and as I say, I think marks a sort of significant change point as the board becomes more future focused in terms of the things that we need to do. Finally, I just need to highlight that the board actually met in private session this morning. It's the first time that we've done so. It's something that we are unable to do under the under our standing orders when we have an item that we need to pick up which is sensitive in certain ways. So this morning the board met to approve the formal business case of the Laboratory Information Network Cymru, known as the LINC business case. That business case is being managed across all NHS or all the health boards and a number of trusts and ourselves, because it represents the next stage of the development of information systems that underpin our laboratory management, our pathology systems across the NHS in Wales. So absolutely critical for effective patient care. So we approved that formal business case today. Other health boards and trusts are so doing. And we approved that this morning. The reason it was in private because of the commercial sensitive information contained within the report. Having done that, and on the assumption that the other boards and Welsh Government ratify their various approvals, the contract award for the new LINC system will be made by Digital Health and Care Wales to the successful supplier. And we have planned now an extraordinary public board meeting which on the 14th of October to undertake that task. As I say, that is contingent upon all of the other boards formally approving the formal business case, but there will be a further board meeting on the 14th of October to move towards the contract award. That is all I wanted to pick up in what is effectively my last chairman's report. So again, my thanks to you all. If I don't see any questions in the chat bar or comments on anything that I've raised, so I will move us straight on to Helen, and Helen Thomas will take us through her monthly Chief Exec's report. Helen, over to you.
Thank you, Bob. So just a quick update from me. I've had a couple of discussions since we last met. I managed to get an introductory call in with the new interim Chief Exec of NHS Digital. So really good to get that in the diary. And actually I managed to catch him yesterday speaking at the Health Excellence Through Technology conference yesterday. So we've got some further conversations lined up because there's a lot of joint work in now with NHS Digital on a number of our kind of initiatives and national programs. So it's really good to create those relationships. I've also had a meeting with Lee Waters, who's the Deputy Minister for Climate Change, and he's got a passion and an interest in all things digital, and has been the driving force behind the Centre for Digital Public Services. So yeah, really good discussion with Lee, and I think we'll follow them up in future with more conversations. He just wants to understand where we're at really for digital health and care in Wales, and ensure actually that we are making all of the joins and connections sort of pan-public sector, if you like, to ensure we deliver the best services to the wider public. So yeah, follow-up conversations to come on that. We've also been having exec-to-exec strategic engagement sessions. So we had a really good discussion with Swansea Health Board just the other week, and actually reflecting and thinking on the joint working that we're already taking forward with Swansea. So lots of good kind of joint initiatives, like development of the Wales nursing care record is actually being delivered and developed out of Swansea in terms of their software development team, working under the national programme. So lots more opportunities, I think, in terms of working in that collaborative, federated way, if you like, to deliver national systems and services. So and actually we've had some follow-up conversations as well around how kind of we support that more regionalised working as well, and how we connect how we can support those connections being made at a regional level. So in Swansea's case, actually across to Hywel Dda and other partners. On the agenda today, we've got a paper that's setting out our IMTP approach, our integrated medium-term plan. I won't labour that. We're gonna cover that later on the agenda. But we're going full flight into now IMT development season, so it's going to be a busy autumn really in terms of getting us to the outline submission date at the end of January for us to submit that. And then just a couple of points around some of our major programmes. So the Cancer Informatics programme is a significant initiative for DHCW, working collaboratively across Wales with the cancer community, and particularly actually working really closely with the major system implementation that the replacement of the CANISC system actually necessitates out of the Bwrdd Cancer Centre. So the national programme is due to run until November 2022, but we've been accelerating that programme at some pace. There's been an awful lot of additional work that's gone on over the last year to try and get to a shorter implementation timeline really for the replacement of CANISC. And where we've got to with that is actually we've been working really closely with colleagues in Bwrdd to really understand the level of service change and the level of functionality that needs to be delivered to support what is the replacement of a system in Bwrdd that's been underpinning their cancer pathways for more than 2 decades now. So you can imagine how deep-seated and ingrained the system and its ways of working are to the delivery of care out of the cancer centre. So with that in mind, the Cancer Informatics Board has agreed that actually a September go live for that was not actually going to be feasible, and that it needed more time to ensure that the testing and the training of the new functionality that will be delivered from the Welsh Patient Administration System and the Welsh Clinical Portal to support that cancer management, it needed longer, and the plan now has been agreed that at the end of May 2022 will be when Bwrdd NHS Trust will actually take that service. In the meantime, it's still a lot of work, so we've added additional functionality to the first iteration now, the first phase of the software that will be delivered for Bwrdd to do their final testing, and then all of their revised new ways of working. So all of that functionality will be delivered from now through to November to enable all of that new ways of working to happen. So whilst not going live at the original point, actually more functionality and with greater support in terms of that business change happening to ensure that safe transition for them. Then on e-prescribing, we've got again a paper on this on the agenda coming up, but I just wanted to emphasise really the major priority that the prescribing programme is for us as an organisation. So we've been asked by Welsh Government to set up the Prescribing Transformation Programme, and so just to point out that actually is it's really exciting, but also for us at the moment it's really working through how we can accelerate moving that programme into initiation phase and to work through what that means in terms of our wider reprioritisation, potentially in terms of the additional resources that's going to take, but I'll touch on that further when we come to that on the agenda. Again, it'd be remiss not to mention really the COVID pressures and the support for the response. We all appreciate the extreme pressures that the NHS is currently facing going into autumn winter time. It's already pretty precarious in terms of the unscheduled care agenda, and of course all of the backlog of elective waiting lists. There are still lots of requirements that are needed from a digital perspective from us as an organisation to support the COVID response. And we've just seen that fantastic presentation from Jill and the WIS team to it's been pivotal to our ability to respond as a nation, but it keeps coming really in terms of the work, and it was just to point out to the board that we're still continuing to manage the new requirements as we move forward to support the COVID pressures. And then of course good news for us, actually. I think we were on a call when we got the news of this quite recently last last week, but our procurement team, Digital Health and Care Wales, have won the Government Opportunities Excellence in Public Procurement Awards. So, and that was for the outstanding response to meet the requirements of COVID, and it was in the procurement of the contact tracing system. So we are ecstatic to have won such an esteemed award there. So hats off to the procurement team and all of the team, really, that because it was very much a team effort across all of our services to get us to that point. But yeah, excellent, and wanted to celebrate that today. And then finally, for me, really, is just to say a heartfelt farewell and thank you to Bob as our interim chair. As he, actually, it's a lovely way to go, actually, Bob, isn't it? Chairing your final board meeting on the actual day that you're handing over the baton to Simon, who I'm pleased to say is on the call. But I just wanted to wish you all the best in your next adventures, because I know you're not going to be putting your feet up quite yet. But and also to take this opportunity to thank you for the support and leadership that you've shown us and me personally throughout your time as interim chair. It's been a pleasure to work with you, so thank you, Bob.
Thank you, Helen, for those kind words, and likewise in terms of working with you too. It's been absolutely fantastic, and yeah, I'm not sure whether it was a good thing or a bad thing, particularly having this as my last day with a full board meeting. But it does seem to round things off quite nicely, doesn't it? Okay, I've got one question I think to come in from Ruth. Ruth.
Yes, thank you, Bob. Thank you, Bob. Thank you for that report, Helen. Congratulations to the procurement team. I think that's a great piece of work, and wonderful that they've been recognised for that. Just one comment on your report with regard to e-prescribing. I just wanted to reiterate the kind of the priority level that we see that as. It's been a massive priority at the vice chairs network, and in my engagement with the vice chairs, e-prescribing has been consistently one of the things that we need to get a move on with and set up and deliver across the system. So I'm really pleased that we're getting moving with that. Looking forward to the update, and we'll be taking an interest at the next vice chairs meeting as well to look at e-prescribing. So I'm looking forward to being able to move that one forward. So thank you for that. Thank you.
Thank you, Ruth. And just to emphasise that point, I saw just this morning, it was the briefing from the questions at First Minister's question time yesterday, and I think one of the first questions up was about e-prescribing and the political pressure to drive that programme as quickly as possible. So I think we're kind of aware of where that is. And before I just leave this item as well, I'd just like to add my congratulations as well, Helen, to the team on the Go Award, because as you say, it's a very prestigious award, and it does reflect, another example of the amazing work the organisation has done over this period in terms of the support for the pandemic, and things like procurement and stuff often goes unnoticed, doesn't it? Because it can be kind of behind the scenes, but it has to be done well. It has to be done properly, and people have done an amazing job. So thank you for that. If there are no further questions in relation to Helen's report, we will take a 10-minute comfort break. We are a little bit behind schedule, but I'll try and make sure we get back as much as we can. So I think it's 11:13, call it 11:15. Can we come back at 11:25 actually, and then we'll kick off with what is quite a crowded part 5 for the agenda then in terms of the strategic items. So I'll see you all again in about 10 minutes. Thank you. Welcome back, everybody. I'm going to take us now into part 5 of our agenda, our strategic items, and we've got a number of quite big items we want to get through in this section. I'm going to hand over, first of all, to Carwyn Lloyd-Jones, our Director of ICT, and Carwyn's going to take us through a brief update on the data centre transition project, which is one of the major projects that the organisation's managing at the moment. Colleagues will have had a chance to read the paper. This item is here principally for board assurance today to understand where we're at. But Carwyn, I think as well you'll be able to give a little bit more of a most recent update from the last weekend's work, which has happened obviously since the paper was actually written. But I'll hand over to you, Carwyn, if you can take us through your report, please.
Okay. Thank you, Bob. Right, so just a quick bit of background as Bob mentioned. So the project is to move servers and services from one of our data centres to a combination of a new data centre and some services moving to a cloud provider. So the original data centre provider notified us last autumn that they didn't want to continue to provide data centre services. Also, that data centre was around 10 years old and had limited levels of resilience on a kind of power and cooling system. So to support the move, we put a new network into the new data centre, as the old one was also reaching the end of its life. So the majority of the physical servers were being moved in 8 batches over 8 weekends. So some services, which are some of the third-party ones, and a small number of our own servers were being moved midweek. And also, as part of the work, some old and supported hardware was being decommissioned and replaced as part of the move. So at the time of writing the paper, 6 of those weekends had taken place. After weekend 4, we found an issue with the quality of some of the cabling work that had been installed by the third party who did the move as part of that weekend. And so we needed to resolve that. To do that, we merged the weekends 5 and 6 into one, and then used the other weekend for that third party to come back and correct the cabling. And that was done at their own cost. We've agreed a kind of a rebate from them as well to pay towards the additional overtime that we encountered as a result of that. So as Bob said, the paper's a little bit old because it was a few weeks ago. Now we have completed all 8 planned weekends. And the vast majority of the equipment has now been moved. The only significant equipment that remains is our test and development system, which is being migrated to the cloud rather than being moved, and also the Welsh Community Care Information System. So I'll discuss these a little bit further when I come on to talk about risks and issues. We also then have some network changes that need to be done to sever the links to the original data centre and to get traffic to go directly in and out of the new one. So in the risks and issues, there are 3 that have been sort of escalated for awareness, really. The first is related to that WCCIS, the community care system. So as a third-party provided system, advanced, used by both council and health boards, it sits on its own special network that's provided as part of the PSBA, the public sector network in Wales. However, it also has its own connections to the other data centre and its own internet connection, and there have been delays with the provisioning of those circuits, so those servers haven't been able to be moved yet. So we're managing that in 3 ways, really. We're working with the original data centre provider to extend the time that we can keep the WCCIS equipment at that site. Our contract allows us to extend the complete data centre service month by month until the end of March if needed, but we are looking at a variation for just the required racks. They're also wanting to use some of our legacy circuits for their own benefit, so we're just working up a kind of mutually beneficial agreement with them at the moment. So the other thing we're doing is that Advanced, as the provider and the orderer of the circuits, are escalating that with OpenReach, and we and the data center provider are looking at other options for whether or not we can provision some temporary circuits while the main ones are delivered. So that's the first risk. The second risk is the test and development system, and we're moving this to the cloud. We'd experienced a delay with getting the required connectivity in place. It's known as sort of express route. So this had delayed the migration. So there's a risk that the migration will go on past the 31st of October date. We considered moving it to our other data center and then moving it to cloud, but decided it was better to do, if anything, if we needed to do so, to extend at the data center, and that will form part of the same discussions as before. And the final risk is related to the provision of physically separate connections into the new data centre. So the target is where we will have 2 physically diverse routes, one going out east and one going out west to the nearest open reach or the telephone exchanges. And this is obviously to reduce the risk of an outage at one of those telephone exchanges or somewhere along the fibre path. There have been delays in getting the new fibres installed to one exchange. So the ducts in the ground where they have to pull the cables through have been blocked at several places, and that requires sort of civil engineering works. The latest estimated times for that is mid-October, which is around 3 months behind the original expected date. However, to mitigate that, because when we saw that it was beginning to become a problem, we've installed some circuits on a short-term basis that run south from the premises, and then they run overhead. They run on electricity pylons. There is an additional risk that surfaced since the report was written. It's similar to the others. It relates to the delivery of a circuit at the new data centre, which provides our connectivity to NHS England and then onwards to the other home countries. The circuit has been installed, but we found that it was only able to deliver 60% of the bandwidth that had been ordered. So they're working on that, but there is a risk that we would need to keep the current circuit live at the original data centre as well. But it all comes down to a potential need for an extension, which we're working on with them already. So in conclusion, the work has gone really, really well. The teams involved have done an excellent job. It's not been without its challenges, but we've been able to manage most of those internally, and there's been very limited disruption as part of the move. We still have a reasonable amount of work left to do, things that I've described. It's also worth noting that we've received some really positive feedback from our external stakeholders on the project planning, the activity itself, obviously, and the communications. So that's it from me.
Thank you, Carwyn. That's really helpful in terms of a very succinct update and just bringing us up to date with the paper. As you say, again, from my point of view, I suppose when I thought about this role that I'm doing as chair early on, and I was told about this project, that was one of the ones that, ooh, that's a big one in terms of what it means and what the potential risks are. And I'm delighted that you've been able to take this through with the team in the way that you have. And obviously, there's still a way to go. There are some delays, but given the complexity of the project, I'd just like to offer my congratulations to you and the team and all of our suppliers for the work that's been done to get us to where we are so far. And as you say, I've had positive feedback from stakeholders too. I don't want to tempt fate, but no major disruptions and so on with service. We note the yeah, absolutely, Claire. Fingers crossed. No, it's not fingers crossed, because I know how much you've done in mitigation, and I think we note the risks that you've highlighted and the mitigations that are in place. So that report was there for board assurance. Before I move on, I'd just like to pause to see if there's any board members who want to come back in and pick up any specific questions with Carwyn, either in terms of the body of the report or any of the issues that he's raised in terms of the risks which are being managed as part of the programme. No, I'm not seeing anything coming through. So, Carwyn, thank you for that. And that kind of seamlessly sort of segues really into the next item on the agenda, because you've alluded to in your report, Carwyn, about elements of our service moving to cloud. And again, this is one of the sort of major strategic issues facing DHCW. So I'm going to hand over now to Claire Osmondson-Little, our Director of Finance. Claire's just going to take us through, and for all those stakeholders and so on who are joining us, to really give an outline in terms of the broad approach that the DHCW is proposing to take to its cloud strategy. So it's not the cloud strategy per se today, but it's about the broad approach that we're taking to that and some appropriate background. And this report is here for noting by board members today. But Claire, I'll hand over to you.
Thank you, Bob. Yes, you're absolutely right. One of DHCW's key vision is to deliver the information and technology for a better healthcare. And of course, to support that, we want highly scalable, innovative, elastic infrastructure that enables us to deliver robust and reliable technology platform. It's also a key aspect of our future strategy, because it will complement our approach for the open architecture but also support our product strategies going forward. And it's also an important aspect to the national data resources and also for services, digital services for patients and public. So for us, it's a really important aspect of our future direction, but it's also important for a number of other reasons. The sustainable business model is also important, and obviously our data centres have a carbon footprint. So the environmental aspects of our future strategy is also for consideration. The other part of this is actually in September 2020, the consultation paper from Welsh Government actually indicated that DHCW would adopt a cloud-first approach, but equally it indicated that all existing application and services and infrastructure would transition to cloud if it was able to do that. So with that backdrop, we felt it was very important very early on to really define what we consider to be our approach to that cloud adoption. So we've established an internal team that would work on the DHCW's roadmap to a cloud adoption to really complement our IMTP plans, which will be submitted later in the year. We recognised that we needed some expertise and support, so we have worked alongside Gartner to find out best practice in the field, and we've also consulted with Red Cortex, who have experience in the Welsh public sector of cloud adoption strategies. We've also worked alongside a All Wales infrastructure review that is currently underway, and this works alongside that and complements some of the aspects of that. So to start off, we really spent a bit of time considering what our strategic principles around cloud should be, and we've proposed 12, and we've made also an assessment of our current systems to look at their ability to adopt cloud to really inform the transition aspects of the cloud strategy. But we recognise that this isn't just an infrastructure programme, this is actually an organisational change. So to enable that our employees and our staff recognise what cloud is as first, so that we all have a common level of understanding, but equally to engage them in the development of that strategy, we undertook a number of workshops in September with some of the key staff members that would be impacted by a cloud strategy to discuss and share our principles, to really work on what are the risks and what are the benefits, to start to develop our vision and ambition around what our cloud migration would look like, and also the timeframes in which we should undertake that sort of exercise. We were keen that DHCW have a cloud adoption strategy that we can all understand, but equally all deliver. And those workshops enabled us to open our eyes and look at all the broader implications for cloud that we are now getting to grips with. So where are we with this process? So the most important aspect at the moment is to really understand how we would deliver cloud and at what speed we should look at transitioning to. So we are still looking at the capital and financial requirements in a bit more detail for the next 3 to 5 years. We've made linkages with the national data resources and also with the open architectural team to really understand the linkage and alignment with our product strategies and our future directions. Another key aspect to cloud was the fact that we will have to look at our governance process and implications, and actually take probably a national role in setting best practice in these areas. So again, this will be a work stream that we will put our head around over the next few months to ensure that we approach that in the most pragmatic way. And finally, but quite importantly, the commercial strategy and roadmap around our cloud suppliers has also been drafted, and again, will be finalised over the next few months. So what are the next key steps? What we want to ensure is that we have our cloud strategy ready and aligned for the IMTP planning process. We have finalised our strategic approach, and we are now looking and translating the implementation of that and the financial and commercial consequences of that. We would look to present those as part of the IMTP board presentations in November. We'd also like to start to engage more widely in our approach. So we would look to, together with the All Wales Infrastructure Review, the Directors of Digital and other national bodies, to share our approach and see what we can learn in terms of their thinking. The key now is that we establish our work with the work streams that I've already detailed and start formulating the implications for us as DHCW over the next 3 years, and that will be the focus of our approach between now and November. So I would like the board to note our progress in the cloud strategy to date, and I would welcome any questions. Thank you, Bob.
Great, thank you, Claire, for that update, and obviously colleagues have been able to read the background paper to that as well, and indeed we've had offline briefings as well in relation to the background to this. Certainly from my point, it does feel like again a very important sort of next step, and in terms of the work that we need to do, and I think you've touched on the quite a wide range of benefits that we would expect to come from this. Things like increased resilience and the flexibility in our infrastructure, the environmental impact and so on. So very much welcome that. I'll come back to just one question I've got just about timescales in terms of next things to board, Claire, in a moment, but I can see that David Selway wants to come in with a question. So David.
Thanks, Chair, and thanks, Claire, for the briefing. Really good paper, and I fully support the approach you're taking in terms of mapping out our strategy to move to the cloud. I just wanted to pick up on one aspect in the risk section, which is to do with the skills that we will require as part of our transition. I know from my experience in the private sector that can be really difficult. And what I would ask is, as we move forward, could we identify the new roles that we're going to need that don't exist today, particularly around platform support and DevOps, because those skills will be difficult to acquire. I fully support the proposal around training staff internally. I think that's definitely the right approach, but it does have some limitations, and I would advocate that we look at some sort of hybrid model where we train the bulk of staff that we need, but I think we need to bring in somebody with experience probably from the private sector to be part of the team and to get some knowledge transfer and to quickly learn some of the lessons of how you transition to the cloud. So again, I fully support, but would ask that we pick up a couple of actions as part of your next steps around defining the roles we need and looking at how we intend to fill them.
Thank you, David. And yes, you're absolutely right. We plan to have a work stream that would look at workforce and workforce development, both from a technical perspective, but also from a support perspective, because as you rightfully highlighted, the implications are much broader than just technical, and the finance in particular and commercial aspects would need some dedicated resource to look at. Yeah.
Great, thank you, David, for the question. I'm not seeing any other questions there for the moment, but Claire, just in terms of one thing I just wanted to emphasise for other people who are, potentially observing our meeting today, when we're talking about the cloud, this is our cloud strategy as DHCW. Yeah, this is not the NHS Wales wider cloud strategy, and I think you've alluded to that a lot of this is happening in partnership and learning between ourselves, health boards, and others as the whole shift to cloud happens. But also, I guess, it's recognising that this is a long-term process, isn't it? In terms of when we're clear, it started. It's not like we're waiting for things to start. We've already got things which are in cloud, and Carwyn was just talking about that as well in terms of the previous item. But clearly there are a lot of legacy systems, and there will be a tail, as it were, in terms of even if you go digital first, you've still got to manage that kind of history kind of out of the system over a period of time. So it's just to recognise, I guess, that this is it's a long-term project, but a very, very important one. Can you just confirm for me, in terms of at what point are you expecting to bring something back to the board next on this?
So we would hope to align that with the IMTP plan, which would be in November. Yeah.
Okay, brilliant. Thank you. Okay, I don't think there's any other questions coming through in relation to cloud. So Claire, thank you again for that. I'll move us back now to Helen, who's going to pick her update on one of the items she touched on in her Chief Executive's report, but the e-prescribing update, Helen. So a slightly fuller report again for the board to note today. So over to you.
Thank you, Bob. Yes, so as Bob said, I've already touched on this in my Chief Exec report, but actually this is just setting out the ask, if you like, of Welsh Government to us as an organisation and what that means and where we're at the moment in terms of providing the board with an update. So we've been asked to set up and establish the e-prescribing National Transformation Programme. And it comes on the back of a review that Welsh Government commissioned in 2020 to look at what it was going to take really in terms of delivering a multi-sectorial e-prescribing platform for Wales. And 4 recommendations came out of that report that have been fully endorsed by the Minister and Welsh Government. And that is to look at primary care electronic transfer of prescriptions. So the board may reflect actually that's been a bit of a gap actually in Wales, and when you think of the remote working capabilities that we've introduced to support GP practices in response to the pandemic, actually needing to still have somebody in the practice to print and then wet signature the prescription kind of was a hindrance, if you like, in that process. So this the focus on primary care is about actually how do we take that printed script out of the process and digitise between GP practices and pharmacies, community pharmacies. That one we see will be working closely, we would hope, with NHS Digital colleagues in terms of the solutions and aligning the solutions that are already in place over the border. The second area is hospital, e-prescribing and medicines administration. So this is how do we actually, again, take the paper drug chart, which has been highly successful actually. There's a standard all Wales drug chart that's been in place for a number of years now across NHS Wales, but actually that whole process of prescribing through to dispensing and through to administering drugs at a ward level to actually be supported and digitally enabled. And the third is patient access. So this is about actually those core capabilities for patients to have access to their medication information, their medication record, but also to interact and to be able to order repeat prescriptions. And the fourth is the National Medicines Repository, and in some ways this is the anchor project within the 4 for the whole programme. So this is the creation, and we reflected earlier, didn't we, on the development that we've taken forward to essentially develop a national vaccine record for Wales. This is the equivalent in terms of that national master medication record for all of our citizens. So the approach will be to take the 4 projects in parallel, but also not to reflect really on the learning of some areas that have already been undertaking work in this area. So one specifically around hospital e-prescribing is in Swansea Bay University Health Board, where they have successfully implemented across one of their sites and are rolling out now to the rest of the organisation. So an awful lot of learning and understanding of what it takes to make this a success, because these are highly complex business change projects and programs of work that need kind of a whole system approach to make them successful. And then in terms of the access to the medication record for our citizens, that will be taken forward in partnership with the Digital Services for Patients and Public programme. That's our national programme to drive forward that kind of digital enablement of an interaction between patients and the health service. And then the National Medicines Repository will be taken forward as part of the National Data Resource Programme, because it's a key element of the national repositories and the national architecture. And in some ways, as I've said, that's the bedrock. That also then will enable the full messaging that we need in place for that data to flow around and across the architecture and through into downstream systems. So the approach is to set up the national programme governance and to take forward the 4 areas in parallel. So we're currently working with Welsh Government, and the sponsors are the Director of Technology and Transformation, Ivan Evans, and the the Chief Pharmaceutical Officer, Andrew Evans. They're the sponsors within Welsh Government, and we, as Ruth reminded us earlier, this is, you know, a key ministerial priority for the Health Minister. So the sponsors are there. We're in the process of identifying the Senior Responsible Officer for the entirety of the programme, and as you'll see from the governance diagram, there it's lining it up with existing programmes and projects of work, and ensuring that we get the right representation and stakeholders around the table. And in advance of us getting the full representation and the full board in place, we would be looking to accelerate and get a steering group discussion in place so that we don't delay, because I think one of the other things, the key message in all of this, is that this programme of work needs to be taken forward at pace. So how do we get this moving, and how do we move forward with the level of agility that actually is the expectation from the NHS Wales Leadership Board, which is where this was endorsed back in August. So we aim to take an update back to them in terms of setting out the governance, if not in October, but in November, to provide a full update. And I think that was it, Chair. I'm happy to take questions. You're on mute, Bob.
Oh, I was determined to get through my final board meeting without doing that. There we go. I'm fallible. Helen, thank you for that in terms of the update. Marion, I can see Marion wants to come in with a question.
Diolch yn fawr, Cadeirydd. Diolch, Helen. Thank you, Helen. Really helpful update there. A point of clarification, I guess. This is a whole system approach, as you rightly said. And I'm looking for assurance, I guess, in terms of patient safety. That's clearly highlighted as some of the benefits arising from this very important project. We do know that there are a significant number of patients being hospitalised because of adverse reactions to medications. And just reflecting back on the pilot in Swansea Bay, very often these adverse reactions are missed or undiagnosed. And I just wonder how this system change will help clinicians recognise or highlight the danger of adverse reactions, so that it's very much on their thought processes as part of this new system.
Yeah, and clearly the governance will take into account all of the kind of assurance and the safety considerations that would need to come in. The big step forward is having a national medications record, so that we know all of the medications, and we would have the prescribing history of that as well. And we don't have that at the moment. We have some good information that flows around the system. We don't have that master central repository, but also then in terms of how we can highlight across the architecture in downstream systems where adverse reactions have taken place. I can see that Rydian's put his camera on, so I do wonder whether Rydian wants to come in and respond more fully on the adverse reactions, because he's been closer to that.
Yeah, Marion, you may be cited that it was Professor Routledge and Ruth Hussey who introduced the yellow card scheme that came out of Landoc, I believe. Digital systems would allow for us to record that information in a more structured way, to share it when considering product-related interactions, which is a key part of patient safety. And then, of course, as highlighted, with a single source of the truth of an individual's medication, regardless of where they present, the current medication that individual is on and the history of reactions of that individual is presented to those care professionals who are looking after them. So I think it's, and the literature reinforces, is a massive step forward for the individual, a massive step forward for prescribing and dispensing across all care settings, and is going to be exciting to deliver.
Thank you, that's good to hear. Diolch yn fawr.
Thank you, Marion, and thank you for coming in on that one, Rydian. I've got a few other questions lining up. I've got David, and I think Sian and Rowan want to come in on this item. So David, can I go to you next, please?
Thanks, Chair, and thanks, Ellen, for the briefing. Exciting programme. I note in the paper that DHCW will be recruiting a programme director to front up this programme, which is great. And noting your comment about the need to move with pace, can you advise if we're able to press ahead with the recruitment of that programme director now rather than waiting, and hopefully get them on board sooner?
Yes, I can. And if it's not out already, the button is about to be pushed. I can see Michelle is nodding, so it's out, is it, Michelle? There we go. So the programme director and a programme lead, actually, so that we can strengthen that. And I am aware that conversations with prospective SROs are also taking place with colleagues in Welsh Government as well. But yes, and we've been given advanced funding to initiate the programme to get it set up as well from Welsh Government as well.
Excellent. Thanks, Helen.
Thanks, David, for the question. That's good news, Helen, in terms of that early progress. You can't do this without the leadership you need in place. Sian and then Rowan. Sian?
Yeah, Helen and Michelle, my question follows David really on pace and making sure we deliver. What reassurances can you give everybody, because there is a huge expectation for this programme? I'm delighted that we're recruiting the leader, because that clearly will help. What are we going to be doing differently, or how are you reassured that we're in the right place to deliver this with the pace that people are expecting?
Yeah, we've been doing a lot of reflecting on that, to be honest with you, Sian. And the first thing is to get good leadership in place and to recruit, a very experienced, we would hope, and senior leader as the programme director, but also to ensure that we've got that central resource in terms of the programme team, to make sure that we've got that and that we've got the technical skills in place. So we've reviewed, there's quite an extensive list of resources that we're going to need here and then out in the health boards, actually, because clearly the bulk of the business change, which is where a lot of the support is going to be needed, is clearly at the coalface and out in the health boards across the care settings. But we've been reflecting on ensuring that we get the right level of resource in order to set ourselves up to succeed. And we've had those very open conversations across the Directors of Digital Group and with Welsh Government really to make that happen. It will mean, I think, initially, because we want to move at pace, that we are going to look to review how we can prioritise this over other things that we're doing in the plan. That's the reality as it stands at the minute, because we can't immediately put people, put new people in place. That does take weeks and months at times. So we will be at the moment reprioritising, particularly in terms of the defining the architectural standards work that needs to be defined for all of the specifications that we need to put into the framework that's being developed.
And what if, from a governance point of view, will there something different happen, or something you've learned from perhaps what we heard earlier about the immunisation system? Do you know what I mean? Is there, from a governance point of view, to make sure everybody's collaborating, is there something from that perspective that we can take forward?
Yeah, definitely. I mean, we heard, I think, really strongly from Jill there, actually that agile, they truly adopted agile ways of working, and agile, if, in my mind, agile is, well, just a methodology around developing product. It's a communication, isn't it? It's actually the approach to communicating effectively across whatever development. So definitely learning from that. You can see it's a fairly kind of complex yet simple governance diagram. I think leadership across all layers and levels of that is going to be absolutely key, but also working in more informal ways around some of that as well. So I think that there will be that kind of keeping the chief execs and the Wales Leadership Board updated formally, but also the informal conversations across kind of the directors of digital to drive this forward, and also clearly with the medical directors through Rydian's work around that table, really, just so that we've got all of that buy-in on board, and that we head things off where we would need to, actually, that we need to kind of work through, and we know that there'll be bumps in the road with any programme the size of this initiative, but yeah, it's making sure that we've got all that communication in place, really.
Diolch yn galon, Helen. Thank you, Chair.
Thank you, Sian, and again, Helen, for those responses. It's interesting. This is going to be a very, very visible programme for us, isn't it? And genuinely one which the public will feel the difference with when it happens as well. I'm going to take one final question on this item. Rowan.
Thank you, Bob. Helen, I think we've heard today that the pace of work and the volume of work that DHCW is being asked to do across the board. So we've got the COVID response ongoing, we've got e-prescribing, the cloud activity, NDR, and these are all big items in and of themselves. The cloud strategy. There's a real pressure on resourcing and workforce. And we've spoken before about having to take resource away from things like NDR to put on the COVID response, and I 100% support that decision. As we look forward into IMTP, I'm just going to ask, is there anything that we can be doing as a board, perhaps in our board development sessions, to ensure that we really have sufficient resourcing to deliver on all of these projects, because they're absolutely critical to Wales, and it feels to me that there's a bit of a dependency across these projects that perhaps isn't always fully reflected in the individual projects. So really asking you for any indication that whether or not there's anything that we need to be doing as a board to address that perhaps implicit risk.
I think your point is well made, and actually is absolutely critical to us developing a deliverable integrated medium-term plan, isn't it? Essentially, and that's what you're saying. You want, as a board, we need as a board to be assured that we are able to deliver. So therefore, we've set ourselves up to deliver, and we've really understood the strategic alignment across these programmes of work, and that we have that oversight as a board. So I think through our IMTP development that we have that, and then ongoing, really, I think there's something there for us to ensure that as a board we have assurance that we have that strategic oversight, and that we have that shared prioritisation and delivery and understanding of risk across all of those major initiatives. So yeah, through the IMTP process, I would say, Rowan.
Okay, thank you. If I can just, I think, come back on that as well, Helen. I think it's the way that Rowan just described that then, in terms of that accumulation of programmes and projects, all very big in their own right, the critical importance of the interdependencies of them. That probably is something that we just need to have a quick look at the risk register as well, in terms of, is that properly reflected? Without going back to it, I'm not sure, but just to sort of pick up on that. And I think for me, it's partly about the another item we're going to come onto on the agenda shortly, which is around structures, executive structures. There's something in here about senior capacity around you and supporting you in the team, which is in our gift. But again, there's a lead time. And again, I think, one of my reflections on this is that there seems to be less argument now when we're looking at these kind of whole system big projects about the resources that are needed to deliver. But the lead time of getting people in is one of the big challenges, isn't it? So, we'll get the resource probably to do what we need to do, but you can't just magic these individuals up and so on. So it does put us in that position where there is sometimes some juggling of priorities to do. And as you say, for the organisation as a whole, at a high level anyway, certainly the IMTP process is the place where we need to have those conversations about what matters most. What are we going to do? What are we going to do first? But that's really helpful in terms of an update, which is, as you say, has emerged really as a very high profile and very significant project for us, important in many ways, and as I've said, one that will improve the working lives of clinicians, but most importantly, it will be felt by patients and the public as well, in terms of the impact longer term. Okay, I'm going to move us on from that item there. So Helen, thank you for that. Change tack a little bit now and go back to Michelle, our Chief Operating Officer, who's got the next item, which is the Strategic Procurement Report. So this is for approval in terms of board decisions today, Michelle, in terms of two particular sort of contract areas. So can you take us through your report, please?
Thank you, Chair. Yes, as mentioned, there are two contracts that I'm presenting under standing orders today, and they are presented for the approval of the board. Also for the board to note the schedule, the sort of forward look, if you like, of contracts that I anticipate bringing to the board for the commercial team are included within the performance report. So we've made some updates to that, and that's also in the board pack, and we'll be looking at it a bit later. So you have a little bit of a heads up of what's coming in terms of the projection. So I'm just going to run through some of the key points. There are some detail obviously in the reports that are in the pack. But the first contract we're presenting relates to our GP managed print service. Now, just a little bit of background on that. It was in 2016, actually, a decision was made, in effect, to outsource the management of printers across the GP practices. So as colleagues will be aware, the GP practices, in terms of their IT services, are supported by a team that Carwyn manages for us inside the organisation, and we provision all of the equipment as well as the systems that they use. As part of that equipment with the printers can actually be quite resource intensive in terms of the support teams, either in terms of fix or in terms of related issues. So I think a decision was made strategically to move towards a managed print type service. We actually contracted with HP back in 2016, and have reviewed and obviously considered the benefits of that outsourcing, and you can see that some of those are articulated in the paper. It's actually been quite successful, I think. HP have proved to be very efficient and very helpful, and obviously printers key to the ongoing operation of the practices, so absolutely key in terms of their business continuity. We have about 7,810 printers at the point of procurement across the whole estate, and that's about roundabout, and I say roughly because it does move a little bit, are 393 practices. So those printers will be used for a number of purposes. There's kind of general printing and correspondence from the practice. There is also more specialist printing in terms of prescriptions or labels to go on sample bottles, etc. Now, those who were clearly listening to the previous item will have noted, well, we are trying to move in a digital direction, and we are hoping at some point to move toward electronic transfer of prescriptions, which would really help in terms of the practices, and one would also hope would reduce our reliance on printers to some degree, but it won't make it go away entirely, and that has been factored into the considerations when we were looking at that. As we say, that's a forward plan. So recognising that printing was an ongoing requirement for the practices, and the original contract with HP was coming up for renewal, we went out, we ran a competitive procurement process for a new 5-year agreement with the option to extend for a further 2 years. And HP have again been successful, so that was in a competitive environment. They've put forward the bid that was the best fit with our requirements at the most competitive price, and the price they put forward is actually a lower price than under the existing agreement, so there are savings directly attributable to the renewal of the agreement, which is obviously really helpful. The agreement itself is funded from ring-fenced funding from Welsh Government in relation to general medical service provision. So the anticipated value of the agreement is a maximum of £8.2 million. That's over the full term if we exercise the 2-year extension. As I stated, we would hope that during that term our print usage would reduce, and there is provision under the agreement to reduce that in terms of scope and quantity, and we would hope to use that. So I would hope to be well within that limit as we go forward. A couple of other points, brief points to note. We've conducted the procurement under a Crown Commercial Services Framework Agreement, so we do, where possible, use these public sector agreements because they are they set out standard terms and they do pre-qualify suppliers, so that's helpful for us in running this type of procurement. And the anticipated approach. So those who are following the dates in the paper will notice there is an overlap between the two contract dates. That was deliberate. because even though we've reappointed HP in effect, they will be deploying new equipment across the practices. So we are still anticipating that we will have a pilot phase, and this was the way that the previous agreement was implemented, a pilot phase where some of the new equipment is deployed to a small number of practices and is thoroughly tested in terms of the service provision to ensure that we are operational and meeting all the requirements before it's then deployed across the whole estate. So there's some time within the agreement to enable that full deployment to take place. I would just like to point out and apologise to the board, there is a slight correction to the paper. So in section 3.3, again, you will notice that the contract start date indicates it's 2022. The contract start date is actually the 1st of October 2021, as it says at the top of the paper, tomorrow. Subject to the board's agreement today, we would seek to execute the agreement. So apologies, and that's a correction in terms of the detailed paper. And a final point in terms of governance from the perspective of our board, the decision to move forward with the procurement and to accept the recommendation to appoint HP has been agreed by the GMS IMTP Programme Board. So they are the board that oversee the provision of IT services to the GP practices. So they agreed the recommendation when they met at their meeting in August. We've also indicated to Welsh Government our intention to award a contract, and they have noted and acknowledged that. So that's the requirement we have of them, and they did that on the 24th of August. So I'm now presenting this for the formal approval of the DHCW board to enter into an agreement with HP.
Again, thank you, Michelle. We'll pause there and just try and take formal approval of that before you go on to the next item, Michelle. Can I take it, board colleagues, that in the absence of any comments coming through in the sideline or anybody waving at me, that we are content to approve the managed print services contract? Okay, yes, we'll record that for the record. Michelle, thank you for that one. Do you want to take us into the next one?
Thank you, Chair. So the second contract, you will note in the papers, relates to the development resources that we utilise for our contact tracing system. That's our award-winning contract tracing system. I can't help myself there. Very proud of my colleagues in our commercial team who took that forward. They do lots of excellent procurement, as we will share over the coming months. But in order to stand up that service, we entered into a short-term agreement with Microsoft to provide us with some development capacity and expertise to develop the solution, which is actually built on a Microsoft product. So their Dynamics CRM product is the basis for the contact tracing system. So that they worked with us in order to develop and deploy the solution on a short-term basis, which enabled us to move very quickly, as colleagues will be aware. But as I would expect, and as is good practice, we then went to the market and we ran an open procurement in accordance with the public contract regulations to invite competition and enable other bidders potentially to express an interest in providing those services to us. So that procurement is now complete. As a result of that procurement, we are actually proposing that we appoint Microsoft again to continue with that development work. It's on the basis of initially a 1-year contract with the option to extend for a further 1 year. Again, relatively short. I think it would be fair to say that there is still a degree of uncertainty around the requirement for the contact tracing system because of the situation with COVID and the pandemic. So we've kept that on a relatively short term to give us flexibility. And I think the other thing to note is that it's purely work package based. So as things change, it's an iterative agreement in effect. That's the way that we've worked to this point. It's based on defined development cycles, and therefore we will take as much or as little resource as we think is necessary to meet the requirements of Welsh Government and our service colleagues as things move forward with the management of the pandemic. What we're also doing alongside that is building up our own in-house team and looking at skills transfer and development of our own resources, and the plan being that as we move forward, if the decision is that the contact tracing system will have a longer term future, then our preference obviously would be to manage that in-house really and develop those skills ourselves. So trying to manage that reliance. That said, we've created capacity in the agreement to spend up to 2.6 million. That is an absolute high limit cap, as I just suggested, and that is based on Welsh Government funding under the COVID recovery scheme, which is allocated by Welsh Government to Digital Health and Care Wales in order to support that solution. So probably the only other point to point out to the board, and you will have noted it in the paper, Microsoft have many strengths and have supported us, excellently over the period, and were material in helping us to stand up our solution. They will only contract on their own terms of business, so they are, unlike many of our other suppliers, they do not accept public sector terms and conditions. They put forward their own terms. That said, we have considered those terms in detail. As I said, they have a track record of working with us and delivering at pace in relation to our requirements, and we are comfortable that we can move forward with them on that basis, and therefore I am recommending to the board today that we execute that further award to enable us to continue the development of the contact tracing system and the support. They provide some support resource for a new agreement to start on the 1st of November.
Okay, thank you, Michelle, again for a succinct overview of that, a very important contract. But I think the way that you've described that in terms of the sort of relatively prudent nature of the way that we're doing this in terms of contract length and so on, given the the fluid nature of what's going on in the system, that this is there to support is very sensible, and also thinking longer term about how we might move to different solutions should test and trace become part of the sort of the fabric of the NHS in terms of the way that it works. So it's welcome to hear that. So again, the board is being asked to approve the contract for the ongoing development resources required for Test, Trace, Protect. Can I take it, colleagues, that you're content for me to confirm the approval of that contract? Okay, I'm not getting anybody say no. So Michelle, thank you. Both of those items are approved in terms of the contracts for award. Thank you. Okay, moving on, and the next item on the agenda, well, it's not moving on for you, Michelle, it's back to Michelle again. I was apologising for this. But in terms of the next item, it's around our stakeholder engagement strategy. A great deal of work has been going on behind the scenes over the last few months with the board and with staff across the organisation and wider stakeholders in terms of looking at our definitions of what we mean by stakeholder engagement and what we need to do in practice. So we've got a first paper to come to the board today in relation to that, setting out the kind of broad approach. So the paper is for approval for the board today. But Michelle, over to you in terms of introducing this item and just drawing out any issues you think you need to today for the board.
Thank you, Chair. Yes, as Bob has mentioned, I think the whole area of stakeholder engagement, in this case, we're particularly looking at external stakeholder engagement, is really key, and we've recognised that as a board, really important to our success as a new organisation going forward. And we actually contracted with a third party to come in and work with us and with our team. That is the Consultation Institute, who have an extensive experience in this area, working with a wide range of organisations to help with our focus and our understanding, and also to talk to a wide group of our stakeholders and potential partners in terms of what they were looking for from us and how they would expect us to approach it. So the paper that we're looking at today is the draft strategy. It's the framework, in effect, for the work that we want to take forward, and is presented for the approval of the board. Subject to that approval, the real work, I think, then is for us to develop the plan. So how will we translate that strategy into a plan that we can all take forward then? And how will we measure that, really, to understand that we are having the impact and effect that we would hope to in terms of our engagement. So a couple of points in terms of the approach that's been taken and the way the document has been developed. And I'm not going to go through all of the detail of this, because hopefully you've all had a chance to read, and we have had some board development time to discuss some of these issues. The really key message and the really important factor, I think, is that Digital Health and Care Wales, and I know we know this as a board, but really important, it's a brand brand new organisation in many senses, so not a rebranding exercise, but a really significant opportunity for us as an organisation and as a team to really move forward with a new leadership team and an organisation that is already reshaping and growing and developing. And as I say that, I'm also really conscious that we've got some fantastic people who work in our organisation, and I wouldn't want anyone to think that we're not, that's a real strength as we move forward. And we met colleagues earlier this morning, including Jill and her team, who've got a massive amount of strength and vision to bring to the new organisation, but very much looking at, okay, what does it mean for us? What does it mean as an organisation? As I said earlier, importantly, what does it mean to our stakeholders? Who are our potential partners? What are people looking for from us? And what does that mean in terms of the purpose of this organisation and the vision and values? And how do we achieve that trusted partner status, which I think is really important and has been discussed many times with board colleagues, and that take on that leadership role, really, as well as listening and responding, taking on that leadership role in digital development and innovation and helping our health and care partners to transform services. So really important, really exciting. I'm quite excited about it, as hopefully you can tell. So in terms of moving forward, it's quite a wordy document. It's quite a long document. I think we've reflected on that. And I think because it's trying to set out the approach that we've taken and the number of stakeholders that we've already engaged with in starting to pull together some of that high level thinking. I'd like to thank board members and other stakeholders to Digital Health and Care Wales who've given up some time to share some initial thoughts and reflections. I think we will, though, produce probably a shorter summary, something a little bit more digestible that we can publish and share with our stakeholders. And we're also keen to receive feedback on this strategy, and we've put that on the document, and very keen for stakeholders and others to approach us on that. So fundamentally, what we've trying to set out is, what is the purpose of our new organisation? I think we've got a bit more work to do on that, and what our vision and values will be, and that will be in the next stage, I think, as we develop our plan. And as I mentioned earlier, how we will measure our impact. We've set out what we're hoping to achieve. We've set out what others have told us about. We've done quite a lot of stakeholder mapping. And we hope to use all of that now to focus and deliver our plan and to move forward. So happy to take any questions, Chair.
Thank you, Michelle. Again, as you say, colleagues have had a number of opportunities to engage in the discussion around getting us to this point, which is you describe as that sort of stakeholder framework, and I think there's a great deal in there in terms of the work which has been done, and right at the heart of it, I suppose that very simple sort of message, isn't it, that DHCW wants to be a very open and engaging organisation. We can't do what we need to do unless we understand the needs, the desires, the wishes and so on of a wide range of stakeholders, which includes patients and the public, not just the other bodies that we work with. Absolutely. So we've got the framework here in terms of taking us on to the next stage, and as you say, Michelle, again, following on from this, the development of a more detailed plan, the kind of who does what when, and what resources we need to do that, and so on. I've got a few questions coming in. I think Sean, you were first, and then I've got Rowan and I think Helen as well want to come in on this item. So Sean, can I come to you first, please?
Yeah, mine is a really quick one. I really welcome this, Michelle. I think it's unbelievably important in establishing our worth and value across our stakeholders and understanding what they want, and the listening, both stakeholders from a health authority perspective, but also listening to our customers, which will be the citizens of Wales. I have a quick ask in approving this strategy, is that I would really, as we are engaging an external organisation, and this is a very wide and long project, I would like to see their outputs and their outcomes in the strategy framework in terms of what we're expecting the Consultation Institute to deliver, by when, what timelines we're going to see, because this is a very you know, and consultants can, not saying that they will, make it as large and as big as they want. So I think I'd really like to see some key milestones, please, in terms of the resources and the amount of, you know, money that we will be spending on them. They've done a great job so far, so it's not a reflection of that, but I'd quite like to see some timelines and milestones for delivery. Thank you. Diolch yn fawr, Chair. Thank you.
Thank you, Sian. Okay, Michelle. Yeah, fantastic. Thank you. Bear with me. My timeline or my question line is dotting around a bit. Actually, I think it's Grace is next. So, Grace, can I come to you?
Hello. Thank you, Chair. Thank you, Michelle, for this report. It's such valuable work. It's so essential, and I've really appreciated seeing all the organisation, everyone who's come together on this, all the work we've done on it, and everything that's coming out in the report. I'm just wondering, given how much the Consultation Institute has supported this work and has given great results, are we planning to bring them or another external organisation in future to ensure effectiveness, insight and reflection as we go forward with that?
Yeah, it's a really good point, Grace, and I probably should, you know, it's been really helpful and really interesting, I think, working with the Consultation Institute. I should also acknowledge we've had a small team of in-house of our own colleagues who've worked closely with them. So some of the build and some of the detail work has already been done by our own team. So I think there's skills transfer and learning going on there, as well as obviously the intelligence that colleagues brought to the process. So it's been quite good. Yeah, I think it can be quite helpful to have that external perspective. I would agree, Grace, as we go forward. It may be that's the Consultation Institute. It may be that we'll work with other third parties, I think, and that's part of, for me, that understanding of the impact that we have, or whether we are actually being as effective as we think we are, or whether there are, you know, stakeholders that we may be missing, or perspectives. And, you know, we're engaging in a range of sectors already, which is where I think the plan will help us to bring that together. But yes, absolutely happy to take that point on board and to think about perhaps the touch points as we move forward, where we may want to work with third parties to help us.
Yeah, thank you, Grace, and thank you, Michelle. As you say, I think it's important to keep that under review as we move into the next phase of the work and review the sort of strategic framework, but also move towards the development of the plan. And certainly, you know, a lot of other people are doing this kind of work as well. So there's a lot to learn, isn't there, from other parts of the NHS and other sectors, indeed, in terms of the way that we engage. I think I've got Helen next, and then Rowan. I hope I'm taking it in the right order. So Helen.
I think actually it is Rowan next.
Is it? Well, I'm going to stick with you, Helen. Now you're live, okay, and I'll come to Rowan. Okay. Rowan will forgive me, I'm sure.
Okay. Yeah, just a quick kind of reflection from me, really. Yeah, endorse. This is a great start, isn't it, for us to set our stall out, really, in terms of the sort of organisation we are and we want to be, which is that, you know, listening and working collaboratively and strategically with our partners. So I think this is a great start. I think the work now in kind of building the plan, what this means to put it into practice is part of that kind of thinking for us, and then how it relates to Grace's question, really, how we then appropriately resource this which was some of the challenges actually and options, if you like, that are in the paper that's been presented to us, really. So we need to think about how if we're serious about this, how are we organising ourselves to be serious and to deliver against kind of what we've set out there. But yeah, no, really pleased to see this come into the board now.
Thank you, Helen. That's really helpful. So I think final comment on this one from Rowan.
Thank you, Chair. Michelle, I think it's you know, it is a wordy document. We've acknowledged that, and it's also an ongoing exercise. This needs to be a thread of the organisation that everyone accepts responsibility for being part of. I also feel quite strongly that we rely on other organisations beyond our four walls, not that we really have four walls being digital, to support some of those conversations. So I'm thinking, you know, Welsh Government in part, other health boards, professionals, and therefore I think maybe splitting some of the engagement activities into, you know, us as an organisation, and then some of the key projects that we are rolling out might be helpful. And I think particularly the patient-facing app that we are building, where there's an awful lot in that might be beyond people's initial expectations about what it might deliver for the public, that probably needs to be communicated to the clinical community as well as the patients. So I would encourage a little bit of organisation to get maximum you know, impact from this. And the second ask I have is, I'm quite humbled by how many people turn up and listen to our board meeting. It suggests that there is an interest in what we're doing, and I would encourage us to think about how people can get in touch with the organisation and feedback to us, maybe via our website or some other means. But I think we need to formalise that, because we are looking for a conversation and not just a broadcast. That's my comments, really.
Thank you, Rowan. It's a really, really positive note, and I did touch on that. I think my contact details are on the front of the paper. Genuinely, if you have any feedback or comments, please do send them through, or you can contact us also through our website. We're very keen to get feedback, ideas, contributions from a wide range of people. So please do, if there's anything that you want to share, and we absolutely will take it on board as we move forward.
Yeah, thank you, Michelle, and Rowan, thank you for those last comments as well. I think they're really important. You're absolutely right. This is, you know, some of what we do is, it's complex, isn't it, in terms of how a system engages with people when we're working in partnership with others, and we do need to reflect that and the things that we do, and only we do, but the things that we do very much with others as well. And indeed, we've seen that today, haven't we, in terms of evidence of the earlier story that we had in terms of the joint working between us and others. And yes, absolutely, that last point in terms of about making it easy to talk to us, I think is really important. So, you know, echo that wholly. Okay, I'm conscious of time and the need to press on. I'm not seeing any other questions coming through. So again, my usual, if I can just sort of pause, because this paper was there for approval in terms of taking us to the next stage. So I'm going to take it, colleagues, that given the conversation today and all the prior discussions we've had, that you are content that we approve the paper, and Michelle and colleagues can take us on to the next stage of the work. Okay, so thank you for that. Okay, moving on. Michelle gets a short break, not too long a break, I think, because she's back again shortly. But Helen, it's over to you. The executive structure proposal we've spoken about before. It's been touched on a couple of times today. Clearly, you've been working very hard on this with team members and colleagues across the organisation in recent weeks, so months. So you're going to just update us in terms of where you're at with the with that, because again, the paper we've got today is to approve your proposal in terms of the next phase of development of the team, and hopefully to enable you to move on, you know, quickly from here today in that. So over to you, Helen.
Thank you, Bob. Yes, so the paper is to set out the final draft proposal from me in terms of the executive structure that we would want to put in place in the organisation. Just to recap, I brought a draft to the previous board in July, and then immediately following that, we shared that with the wider organisation. So we've had a formal consultation with the senior leadership across the organisation, but more than that as well, we wanted to engage more widely and give our teams the opportunity to provide their feedback. So we actually kind of consulted, if you like, and engaged in it quite widely in the organisation. And I think broadly the highlights and I've just kind of put a very high level summary together, but we did receive, and I did read, an awful lot of feedback from our teams really in terms of the in terms of thoughts and suggestions, actually really helpful suggestions in terms of ways forward. But broadly there was support actually for the two executive roles to be one focused on operational delivery and one to be focused on strategy. There was a helpful kind of suggestion that maybe the Exec Director for Operational Delivery, we should call it the Exec Director of Operations to avoid any kind of confusion over programme delivery that could have in that title. So I thought that was a helpful suggestion. But it is probably worth reflecting that the majority of the feedback that we got actually from the wider organisation was in the structures below the executive structures, actually, and in that makeup of departments and divisions and team, really, in those structures below the top tier. And actually there's some of that to be worked through when those executive roles come into be in. So we will come back to review some of that when we've made the executive appointments. There was full support for the Director of People and Organisational Development. So we have felt that support right across the board from day one. And we also, whilst having some suggested different approaches to the Director of Primary, Community and Mental Health digital services, actually there's broad kind of support for that, particularly broad support amongst our key stakeholders, actually, to have that director level position in place to actually provide that strategic oversight of that out of hospital kind of integration agenda that we need to take forward on. So what I'm asking the board to approve is the structure that's been set out in 2.3. But I should also bring to the attention of the board that as part of this process, we've also reviewed 2 roles below the executive structure and employed the All Wales organisational change policy to assess those roles against existing roles, and there were 2 members of the senior leadership team who were affected and fell into the requirements for needing to be reviewed under the organisational change policy, and that we've successfully appointed to the Director of ICT and Digital Delivery below the Director of Operations, and that's the current Director of ICT has been slotted into that post. And the Director of Planning and Performance role has been, our current Chief Operating Officer has been slotted into that role. That happens where those roles match 2/3 or more of an existing role, which is what was assessed to be the case for those 2. So just to say then that we're moving forward on the timeline, again, not as quickly as perhaps we would want, but we've been working on this and lining up all of the activities that need to line up with this and go through the process. So myself and the Assistant Director of Workforce are interviewing the recruitment agencies. There are 2 shortlisted next week. So we will be appointing those to really through October be kind of going at pace really in terms of the search for the Exec Director roles, with a view that we will be shortlisting and interviewing through November, hopefully to make a successful appointment. I should also point out that actually wasn't in the paper, it was remiss of me. But this has moved fairly quickly, is that we're getting now and really grateful for support on the recruitment of the Director of People and OD from HCIW colleagues. So we will be moving forward on that post in parallel as well, whilst we process through the exec appointments. Yeah, so I'm asking for formal approval of the structure, but happy to take questions.
Okay, thank you, Helen. As we said, we've been around this. We've been around this a number of times and had discussions in other fora in relation to this. So thank you for bringing us up to date for the work that's been done following the consultation that you've done internally. So it's a straightforward ask there today, colleagues, in terms of approval of the final structure and giving the green light really to Helen to get on to move towards the open recruitment of the Executive Director posts, recognising there are a couple of external dependencies in terms of the work we have to do with Welsh Government about banding and so on and so forth. But we're doing all that in parallel, and clearly the aim is to be able to get the advert out or get the consultancies engaged with us to get this recruitment process moving again, given the potential lead time that we have for that, but absolutely essential for Helen and the wider team that we make progress. So colleagues, I'm not seeing any questions being flagged for me. I don't think there's any surprises in the paper that you've had today. If there is nothing, I'm going to say, Helen, paper approved, get on with it, and best of luck in making sure you get the right outcome to those key appointments. Really important for the future of not just the organisation, but everybody else that we support and serve.
Thank you, Bob. Appreciate it. Thank you, colleagues.
No, and thank you for the work on that. Not an easy one, I know. Okay, it takes us to the final item that we've got on section 5 of the agenda before we take another break. I'm coming back to Michelle again, who is going to take us through the approach. So this is not the IMTP, it's the approach that we're going to adopt to developing our integrated medium-term plan for the next 3 years, which is really going to be one of the things that exercises the board and a lot of time for people over these next few months, as we do this in parallel with all of the other organisations across the NHS in Wales in terms of preparing the next iteration of our plans for submission to Welsh Government. And as I said earlier, this really is important, I think, for the whole board, because when we came into being on the 1st of April, we had a 1-year IMTP, which has been guiding our work over these first 6 months or so for the organisation, but that was developed before the new board really was in place. The board endorsed it, but it wasn't fully engaged in its development. So this will be the first time for the board to fully engage in the development of the IMTP, which I think is really important. So Michelle, can you just sort of take us through the approach that's proposed in terms of how we do that?
Thank you, Chair. Yes, and as Bob has said, that we will absolutely be spending a lot more time on this together. So the objective today is really just to outline the approach. In fact, we've got some board development time this afternoon, when we can drill down a little bit more into content and priorities from the perspective of the board. So I was going to just run through the key points of the approach, which are in the paper in the pack. Yes, as Bob had indicated there, we are now required to produce our 3-year integrated medium-term plan. This year we're operating on a 1-year plan. That was actually the case across NHS Wales, and that was really a reflection of the uncertainty arising from the pandemic. So the statutory position is normally that everybody produces a 3-year plan. Everybody is currently operating under a 1-year plan. But I think that was quite helpful for us as a new organisation, because it meant we had a little bit of time to work together to think about how we would present our 3-year plan. The other point perhaps to note is that the structure and the content of the plan is largely prescribed for us by Welsh Government. So we have something called the planning framework that will be issued to us as an organisation, and there will be an expectation that we respond in that vein. So the planning framework will set out not only the priorities that are coming down to us from Welsh Government, and I'm told by the Welsh Government planning lead that the Minister herself has spent a lot of time working with the Welsh Government team on the priorities and the planning framework for next year. So we are looking forward to receiving that. We're anticipating we'll receive it towards the end of October. So that's a key dependency for us in terms of the response that we need to put forward. That said, we can't wait really until October, because there's quite a lot of work, I'm sure, as you can imagine, not just for us as a team, but for the whole organisation to take forward. So there are some key points that we've put in the paper then in terms of how we will move forward with the development of our IMTP. I've mentioned there the Welsh Government priorities, and we anticipate that those will be set out for us. We have some insight, I'm sure you can tell from the direction that's already coming from the Minister and Welsh Government. So we are already working on those areas. Really important as we move forward that we are engaging fully with our stakeholders. So helpful, we've just come from discussing the stakeholder engagement strategy. A really key part of the development of this plan is already and will continue to be linking in with our key partners and stakeholders to understand what their expectations are of us and how we will align ourselves. And in fact, we've got a session with the planning leads from all of the health boards, trusts, HCIW, shared service, and the Health Collaborative tomorrow. So we've got an all-day session to start really digging into that. And I think, as Helen mentioned earlier, we're having reasonably regular meetings now, certainly with the key leaders in the health boards and trusts. So we should have a good direction of travel on that. We have put particular focus from our planning team, work linking with the planning teams from HCIW and the collaborative, and indeed the shared service as the other national bodies in Wales. We felt there's some helpful alignment for those organisations as we move forward. We need to reflect the programmes of work. So the programmes of work from Welsh Government, you will see those in the structure that I'm going to move on to. Those align to the portfolios that we've previously identified in our plan. We are hoping very much to present perhaps as an appendix to our IMTP joint plans. So these would be aligning our milestones, if you like, with those that are presented by the health boards and trusts. So we've got a bit of work to do there to achieve that alignment, because as Bob mentioned, everyone develops their plans in parallel. So there's a bit of alignment work that we will be doing. Clearly, the priorities in the plan, the key aspects, if you like, in terms of delivery, finance and people. And we work very closely through this planning period with Claire and her team in terms of the finances and what's available, and obviously with workforce and all management colleagues in terms of the art of the possible. I think Rowan touched on that. Really key that we deliver a plan that we can resource and that we can perform well against. I think that's really important. And important that we continue to build that thread. And I think for those who have seen the 1 year IMTP that we put forward last year, I think we found a way of presenting our plan, and had really positive feedback actually from Welsh Government and other stakeholders in terms of the presentation, the visual nature of the plan and the ability to navigate. Again, we've got more work to do on that, but we've learned a lot, I think, in terms of the work that we've done to date. And I'm going to talk a little bit more about the roadmap. So that's another key aspect as we move forward. So I just wanted to point your attention. There's some really nice, I think, visual representation in the paper. As I say, I'm not going to go through all the detail. I just wanted to point that out, and a big thanks to our Assistant Director of Planning, Ruth, who will be in the session with us this afternoon, who's put these visuals together, I think, which really helps to set out what we're trying to do and how it all fits together. And probably the first thing you'll notice, and we've discussed it as a board, we refer to the strategy. This isn't our digital strategy, just to be very clear. This is the integrated medium-term plan. However, clearly, developing our strategy and strategic direction is a key component of this. So what this plan assumes is that we will and are developing a strategy. To some extent, we will have to do that in parallel with our plan, again, for timing purposes. But in the short term, we think we have some good components of that that will feed in. So we've got the work that we've touched on earlier that we're doing with our stakeholders, the architecture strategy that colleagues will be familiar with, cloud strategy, which Claire took us through, the approach that we're taking on that, and our data strategy, which is also being developed now by the information colleagues, would also be a key aspect. So all of those are currently in development or developed and feeding in to the strategic objectives. The other thing perhaps to note is there is inevitably, we don't kind of finish at the end of March and start on the 1st of April. There's quite a lot of carry through in terms of the objectives and the milestones that we are already working on and that we've agreed with our stakeholders will be important. So those will also need to flow into our plan, and that work is currently underway. So our strategic objectives, and as I say, we've got a session, we'll be drilling into those this afternoon, but we anticipate the shape of the plan we will carry forward from what's been done this year, clearly with refinements and updates. And as we move forward, I think in the medium to long term, then we would expect that to start to change and really develop. So that then leads into our portfolios. So I mentioned the portfolios, there are 11 in the plan this year, and those reflect the key enablement activities and then the programmes as defined from a Welsh Government policy perspective and from the planning teams or the programme teams that have been established to take forward particular work. So that gives us quite a good shape, I think, in which to develop the plan. The portfolios are then supported by roadmaps, and again, that work has started, but we really need to build on that in terms of how we want to take forward the digital services supporting each of those areas. And those will be both in terms of the vision, if you like, for the products that sit in each of those areas and the detailed product roadmaps. So, you know, to be honest, we've got quite a lot of work to do, I think, on our product roadmaps, and what we're anticipating is that we are starting that now. We will focus on the key product areas, and that will be an ongoing piece of work as we move forward. But we are hoping to do enough of that really to really inform the key areas in the IMTP, and that will obviously carry on. It's a live process, isn't it, as we move forward with new and retiring products. Those are the main components then that will feed into that 3-year plan. And then underneath the 3-year plan, we have a 1-year business plan. So that's our detailed set of milestones and objectives that we use to manage the organisation. And also linked into those, as you might expect, would be our release plans and our detailed milestones. And then you'll notice on the far right there, number 7, on my diagram, the national plan. So what I'm referring to there is the comment I made about the alignment, really. And we are having some really good conversations already with Health Board and Trust colleagues about that alignment. And again, I think that will really help us as we move forward to be able to have shared plans. So we've established mechanisms to plan together in a digital form, and then we will both be reporting against the same plans and the same objectives, and we'll be managing those really proactively together. So I think that'll be really helpful. Rather than generally what's happened to date is we've done that on a project or program basis. Having that overview, I think, will really help all of the organisations involved. And the final point you can see on the far right then, feeding into the business plan really would be the team plans and the individual project plans. So it's quite a complex planning environment. I think it'd be fair to say, of course I can't actually say it, fair to say it's quite complex, it's quite detailed. We've got a lot of contributing factors. And as I move on through the paper, that's really why, in terms of the timescale, we've already started on that work. And we're aiming to achieve a draft that we are all comfortable with, and we are comfortable that we can deliver for our January board. And the main reason for that is that we are required, we anticipate, and again that will be confirmed in the planning framework, to submit our plan formally to Welsh Government at the end of January. What generally happens there is a period of review and refinement, so that by the end of March we have a clear and agreed plan with an associated clear and agreed funding position, and that's the basis through which we can then move forward with our detailed planning inside the organisation. So there's a bit more detail in the document there in terms of the stages and some of the work that's underway. You can see, as I've touched on, really key as we move forward is that alignment with our stakeholders, the product workshops and the development of the product roadmaps, really understanding what are we trying to achieve, how does that translate in terms of the portfolios, and then the products that sit within the portfolios, how do those fit together, where's the alignment, the dependencies, where are the risks in that plan? I think it will help us to be much clearer about that. And then how does that all fit together in delivery and implementation terms with our partner organisations? So I will leave it there. I think happy to take any questions on the detail. And as I said, we are starting with our first opportunity this afternoon, I think, to start to drill down to what does that mean really in terms of content and priorities, and how do we want to shape that?
Thank you, Michelle, for taking us through that. As you say, it's largely about the process that we've got to go through. It is complex, but again, very important that we do this and we do it in a way that's aligned with others. It's funny, as you were speaking, I was reflecting on the fact that at one point in my career, I was the strategy director in Welsh Government who used to receive all of these plans. And a couple of things that you've said, i.e., making sure that it's clear where they align with other people's plans and that the plans are accessible and easy to read, makes the individual who receives these, or the team that receives these in Welsh Government's life, a lot easier. So I would echo that and the importance of doing that, because if you want to get your plan approved, make sure that it's something that they can engage with easily as it goes through, because they'll have thousands of pages, won't they, with 12 plans that arrive all at the end of January. So I think the approach you're setting out is very clear. The timescale, as you say, the aim to get a draft, pretty much final draft, back to the January board meeting for submission at the end of that month. So a lot of work to do between now and then. Colleagues, I don't know if anybody wants to come back on anything that Michelle has said about this. As she has said, we later on after the board meeting today, we've got a development session to talk about this in a bit more detail, so we'll be able to start to get into the detail of that. But again, broadly, we're asking, well, not broadly, we're asking for the board to approve the approach that Michelle has set out today in terms of the development of the 3-year IMTP. Okay, not seeing anything, so we'll take that, Michelle, as an approval. Thank you for that. Okay, we're going to take a short comfort break before we move into part 6 of the agenda, which again is another sort of shift of gear. So I'm going to say, could we come back at 1:05, please, to get through the final part of our agenda today? Thank you. Okay, welcome back, everybody. We move into the final section of the agenda today, which is part 6, our governance, risk, performance and assurance section of the agenda. I'm going to hand over to Michelle again, who's Chief Operating Officer, who's going to take us into the first item under this section, which is the Integrated Organisational Performance Report. So this is for discussion for the board. Michelle will highlight a number of key issues, but please, colleagues, if there's anything you want to come in and ask questions on, feel free to do so. So, Michelle, over to you.
Thank you, Chair. The detailed report is obviously in the pack, and I know we've touched on this a number of times in this board. We are continually refining this report. I want to thank colleagues around the board table and within the performance team, particularly in our organisation, who are continuing to work on this and to help to shape the direction of travel in how we want to consider performance. I don't think we're there yet, but we will continue to work on that, and I appreciate feedback and input from a range of individuals to help us to take that forward. So in terms of the key points of the report that I'm presenting to the board today, in the cover report, you can see there are a couple of areas I've called out. Our appraisal position under the scorecard is red. That is not where we would expect it to be. So this is the reflection of the setting of objectives for every individual who works in the organisation, and the monitoring of performance against those objectives, as well as setting training plans and things with individuals. So really key actually in terms of performance and supporting people more generally to deliver effectively. So we're below. There has been some impact there still from the transition, although our electronic staff record is now operating as we would expect it to. As colleagues will recall from the last board, we have had some challenges with that since we stood up as Digital Health and Care Wales. And we are seeing some impact from COVID and other requirements, but we're really a lot of focus on this, and we discussed this at length in our recent management board, and we will be providing additional targeted training for those perhaps who are struggling in this area, as well as setting the expectation through the management train that reviews are undertaken regularly. So I would expect that number to have improved when we next meet as a board. Likely statutory mandatory training, again, really key to us as a public body. And that's probably, well, it's improving, but it's still below the 85% target, and I think we can actually do better than 85%. That's certainly what we're aiming at. So again, there's quite a lot of focus on that now to ensure that we increase that level of compliance. Pleased to say, against a number of the standards, we've moved into green. A lot of work going on, particularly with Claire's team in terms of the new structures that she's put in place there, and a real focus from key teams in terms of our ISO and BSI compliance, which is again really important to us as an organisation. A couple of areas there where we've still got more work to do, but we've seen quite a lot of improvement in that area, which is great. Also an improvement in the commercial services or contract management particularly, which is one of my teams. We've actually increased the size of the team and agreed a new strategy and approach. So really good progress there to ensure that we are maximising the value from our commercial arrangements with suppliers. So also wanted to call out, that's in our sort of scorecard, in terms of the plan, which is obviously really important to us as an organisation. We've put a bit of a summary in there, and I think this is really important just to reflect for a couple of minutes on a considerable amount of delivery and progress actually in the year to date. So we're some 6 months in. It was 5 months, I think, when this report was put together at the end of August, but we've actually delivered a significant amount still during the pandemic, and some increasing demands from a COVID perspective on our teams, as we reflected on earlier. I have to call out the hospital pharmacy stock control system. I've had the pleasure of having some involvement in that, although I couldn't take any of the credit for it, I have to be honest, but our team certainly can. It's been a fantastic piece of work, and that's the whole team. So that's the stakeholders in the health boards and the trusts, as well as the DHCW team, taking a really positive approach, I think, particularly within the pharmacy community. They wanted to make this work, they wanted to standardise, and they wanted to deliver at pace, and that's what they've been able to do. And they've done it by working together as a community, really, and being really focused on what we were trying to achieve. So we have actually achieved a significant amount of standardisation across the piece. And we've deployed now in the majority of the health boards. So again, since the report was drafted, we went live across Swansea Bay last week, all of it in one go. So they went with a big bang approach, as they called it, because they were very confident that they were able to do that, and that went very successfully last week. So it's just Velindre and BCU now still on the list to be implemented, and the plan is to complete those by the end of November. So within a 12-month period, we will have implemented that new system across the whole estate, replacing a very old system, I have to say. I think about 30 years old, the old system. So quite a big culture and business change, as well as the technology change. So really good piece of work there in terms of hospital pharmacy. And again, it'll be a really solid building block, if that's the right word, in terms of how we move forward with e-prescribing. So colleagues will have noted that a lot of the standardisation, the work that's been done in support of the pharmacy system will hold us in good stead as we now move forward with the e-prescribing programme. So really well done to the whole team. The patient platform, again, really key area of focus for us, and it will continue to be as we move forward. And again, the board will recall we awarded the 2 contracts to Kainos when we last met, and that work is now driving ahead with them as our development partners. Cyber resilience unit, so really important. So we've launched the cyber resilience unit. It's actually hosted by Digital Health and Care Wales and is a key component in terms of the priority to protect patient information. So really key in terms of that operating across the whole estate. The nursing care record, again, we will have discussed before, really transformative project in terms of the impact on nurses in particular, and the access and provision of information across the sector. And we've now got that operating in 4 of our health boards and in Velindre. So that's having quite a big impact already. The new data centre, Carwyn helpfully has already updated on that, a little project going on there in terms of moving into a whole scale into a new data centre. Again, big piece of work, really well managed by the team. And all of the COVID initiatives. And I'm really pleased that we got to meet Jill this morning and to hear what her and her team have been leading, and the wider programme team in support of the pandemic, and particularly here we're calling out the vaccine pass, which hopefully is helping us and the citizens of Wales to kind of get back to travelling and attending events safely and being able to demonstrate their vaccination or test status, and that's all being fed obviously from other systems that we've deployed. So really positive progress, I think, in terms of what's been delivered this year. That said, we are reporting the plan as amber, and I'll explain why that is the case. The main issue there is there are 2 key deliverables. They are not late as yet because we haven't got to the end of Q2, but they will be. And we are therefore highlighting that to the board's attention today, because we know that will be the case. So the first, and Helen helpfully picked up the brief on this in her briefing right at the top of the meeting, relates to the cancer replacement programme. So again, massive amount of progress, but a joint decision taken with Velindre to push out the timescales on that a bit, to give them a bit more time, and us and others, in terms of the development, the testing and the deployment, so that can be managed in a safe and effective way. So that is a decision that has been reached with our stakeholders, and will therefore be reflected into the plan the next time that we review it as a board. And the other relates to some of the building blocks in relation, or the definition of the building blocks in relation to the architecture. And so we were anticipating that would be completed in Q2. That is actually being deferred. But the other point I did want to make, and I know a lot of work has been done with the team in this area. Again, huge amount of progress actually, and a lot of really positive work that's going on in the team. So we would expect to be able to update on a positive basis as we move forward. But I am bringing those to the attention of the board, because those will be moving in the next version of the plan that we see when we meet in November. So 2 risks to highlight, and these have been ongoing risks that we're managing in relation to the plan. So the one is around recruitment, and I'm going to come on just to talk a bit about workforce. So we know we've got big challenges in terms of building our workforce at pace. and in response to a bit of a moving goalpost really in terms of additional funding and expectations coming in. As I've reported previously, a number of initiatives in place, not least the use of third-party partners as well. So it's not all about recruiting people, although our team is certainly growing. And the COVID-19 workload. So again, you would have got that message, I think, loud and clear today. We are still seeing requirements coming in, and we are responding to those and trying to be very flexible and responsive. We are building up those teams. It is still having a bit of an impact on us, and may well continue to impact as we move forward, depending on the status of the pandemic. So as Helen mentioned earlier, we're managing that carefully, and we will just, we will need to really understand the impact on our plan. Developing the plan for next year, and we will no doubt talk about this later today. We will also be mindful of creating capacity for anything that may happen as we move forward into next year. So that's going to be really important. So just going to touch, I mentioned it there, if we are growing as an organisation, we are actively recruiting. We do make quite a lot of internal promotions as well, which I think is really positive. It's really positive for our current staff. I think it sends a really positive message. It doesn't actually impact the headcount in the way that we might like it to. So that's something that we're working through, and we're working through how we can put mechanisms in place to recognise that. At the same time as bringing in new and additional people over and above. So we're just below our target that we set ourselves at the beginning of the year now for recruitment. When I do present this in 2 months' time, you will see actually our target will be going up because of some of the new funding coming in and programmes such as e-prescribing that we'll be resourcing up to. Probably the key thing to know, over and above all the other activities that we've been doing, and we're working actively with a number of recruitment agencies, we're having a recruitment fair on the 7th of October. So please do join us, and there'll be key members of our team will be there. We'll have lots of information about opportunities and vacancies in our organisation, and the plan is to have some pretty near real-time interviewing with individuals. So if folks come along and join and are potentially interested in working for our organisation, we'll be setting up one-to-one conversations with people who are recruiting at the moment, so that they can share knowledge and experience and try and fast track bringing new people into the organisation. And that is one of a start of a number of campaigns. We'll also be attending others recruitment campaigns to raise the profile of the organisation and to encourage people to come and work in this award-winning organisation. Those were the key points that I wanted to pull out from the performance report. Happy to take any questions.
Thank you, Michelle, for taking us through that report. Pretty comprehensive. I particularly welcome that sort of focus you've just drawn out there in terms of some of the key elements of the plan, in terms of where we're at. As you say, it remains a work in progress in terms of the way that we report performance through to the board, but I think a very helpful report today, and quite appropriately flagging some of the risks that we're aware of, and we picked up on some of that earlier in the agenda today. Colleagues, are there any questions that anybody wants to pick up with Michelle at this stage in relation to the performance report? I can see one from Marion. Marion?
Diolch Cadeirydd, thank you, Chair. I just wanted to turn to the appraisal completion rates, and you rightly highlighted this is a current issue. The ESR has been problematic in terms of reporting. I just wanted to ask you whether there were any cultural issues over and above the technical issues that we've been facing, because this is a really important area, and I wondered when you think we can get back on target.
Yeah, thank you, Marion. And I would agree, it's a really important aspect of how we support and manage the many individuals who work for us, and how we deliver as an organisation. I mean, culture, I think, is something, raising awareness of individuals of the importance of creating time in the day to sit down and have a conversation about, what we want people to focus on, what they're achieving. I think probably there are some who think, oh, it's going really well, everyone knows what they need to do. We're all really focused on delivery. And part of my role is to remind people, actually, actually that we are, and that's fantastic, but we do need to carve out that time to sit down and have that conversation and to make sure that people are supported and that the level of expectation is clear. And that's really important, and hence the training or the awareness sessions that we are planning to hold, and we do hold those you know, right throughout the year, but we will be perhaps focusing those a little bit more who've been struggling to create that time to carve out. And yeah, I would expect, you know, that those figures will go up. I think the other point I should say, obviously we do have some cases, and I don't want to present this as an excuse because we've reminded folks where people perhaps are having the review or are having the conversation, but they're not recording it in the system. And of course, the system doesn't know, the system doesn't count it. So we are reminding people, please upload that. And I think you touched on it earlier. That's perhaps some of that is a reaction to some of the problems we had earlier in the year. So we will pick up on those as well. So I would expect that figure by the next time we meet in November to have seen a significant increase in that compliance figure.
Yeah, Michelle, thank you. Very helpful.
Thank you, Marion. It's an important point, and I think we've reflected a couple of times today, haven't we, in other items, the kind of pressure and the workload that people are under, and it is all too easy to let slip that kind of more developmental time that we need. And I would certainly add my encouragement to everybody across the organisation to try and make sure you do prioritise time for those conversations, which are, you know, they're partly looking backwards, but very importantly, they're also about looking forwards, aren't they, in terms of how we develop individuals in the organisation to meet the challenges and support them most effectively. So absolutely endorse that point. I'm not seeing any other questions on that report today. So Michelle, I'm going to say thank you again for taking us through that and reflect. The November report will of course be the 6-month report, won't it, effectively? Yeah, in terms of the half-year point for the organisation as well, which is important. Okay, I will move us on. So thank you, Michelle. Over to Chris Darling, our board secretary, now for the next item, which is the risk management and board assurance framework strategy, which includes our risk register. So I'm going to hand over to Chris, and the board today on this is being asked to note the status of the risk register, to discuss the corporate risks if there's anything that anybody wants to raise. A couple of things have been flagged earlier in the meeting on other agenda items, and to note the risk board assurance milestone plan and progress to date. So Chris, over to you.
Thank you, Chair. There's 3 main points I want to cover, just going through the risk management report cover paper, item 6.2. Firstly, I just want to update on the current risk profile position for the organisation based on the corporate risk register. I just want to come back to the question you asked, Bob, around the programme resource risks from the e-prescribing discussion earlier, and just where that is within the corporate risk register. And then I'll just update on the risk and board assurance milestone plan, progress to date, and then next steps that are planned. So just to start with the current risk profile position, there are currently 19 risks on the corporate risk register, 15 of which are detailed in the papers today as item 6.2 II. This is because 4 of the items are cyber related. These are considered in detail in the private sessions of both the audit and assurance and the digital governance and safety committees. Board members are asked to note the following changes in terms of the corporate risk register since the last meeting. So 1 critical risk was removed from the risk register during this period. This is risk 0271 My Health Online, and this is following successful dialogue with the supplier. My Health Online will continue to be supported up until July 2023, which is sufficient time to establish a project for the development and implementation of a replacement service as part of the digital services for patients in the public programme. So that's pleasing that one's been mitigated and taken off the risk register. I would also ask board members to note another critical risk that was reduced during the period. This is risk 0270 legacy load balances. All services have now moved to new supported equipment. Testing is being scheduled to ensure no unknown connections remain, but the risk has been reduced from a score of 20 to 6. So again, significant mitigation around that risk. There were no other major changes to the risk register during the last period, but if colleagues just look at section 2.6 of the cover paper, the risk heat map illustrates that Canisc remains our highest risk score on the risk register as a score of 20, and Helen updated in her Chief Exec report in terms of the current status around Canisc and the work we're doing. So just to move on to address the discussion from earlier around e-prescribing, in particular the programme resources. There are two risks on the corporate risk register that I think relate to this. One is 0237, which is the COVID resource impact, which Michelle touched on in the performance report section. And this is around the risk of moving resources at short notice to address COVID requirements. So that's the first one. The second one that I think is relevant is 0259, which is staff vacancies and the ability to recruit and retain staff given some of the skills shortages, etc. And again, Michelle touched on that. Whether the articulation goes as far as it needs to in terms of the cumulative effect of the number of significant programs we have. We mentioned earlier cloud, NDR, COVID, e-prescribing is something I think we need to look at as directors, but those are the two risks, Bob, that I think relate to that discussion earlier that are captured on the corporate risk register at the moment.
Thanks, Chris.
In terms of the risk register itself, I'll just remind colleagues that we now have committees. The committees of the board have corporate risks assigned to them to provide additional oversight and scrutiny. This includes, as I mentioned earlier, the private risks, and I'd just note that the last Digital Governance and Safety Committee held on the 11th of August had a significant deep dive and discussion into the risks assigned to them, including the cyber risks. And the chair of that committee, Sian, has asked that the next committee meeting has deep dives specifically into the information governance and information services risks on our corporate risk register. So that is planned for the next Digital Governance and Safety Committee. And finally, I just wanted to update on the item 6.2 III or Appendix C progress in terms of the risk management and board assurance milestone plan. So this was developed when the risk management strategy was brought to board in May and approved to monitor our progress as a board in terms of implementing that strategy. If colleagues could just note, I think milestones or tasks as they are in the papers 1 to 5 have been completed. Milestone 6, the assurance mapping and controls, is currently taking place, so that's a bit of ongoing work. And I'll just highlight milestone 9, which is around the board and the organisation articulating its risk appetite. We had a session, as mentioned in the chair's report earlier, on the 2nd of September, where we started to look at our risk appetite. We didn't get to a position where we could agree our risk appetite and tolerance as an organisation. We've got time now built in as directors on the 14th of October to do some more work on this with a view to bring it back to the full board at the development session on the 4th of November. And I just remind colleagues, I think, of the importance of the risk appetite work, communicating this and embedding it in terms of shaping the culture of the organisation. I think it was a point Ruth Glazard raised when we talked about the risk management strategy when it came to board in May. So that's a key element of work that we're hoping to progress over the next few weeks. And I'll pause there, Bob, for any questions that anyone might have.
Okay, thank you, Chris, for highlighting those issues from the paper. I think it's clear that there's a fairly significant amount of progress being made through there. I think I can see, yes, I think Ruth wants to come in with one question. Or maybe more than one question.
No, don't worry about it. I won't. I'll try not to prolong your last meeting for beyond necessary. And I was just going to thank Chris for commenting on the risk appetite work at the end there, because I think as we're talking about working in the open and discussing things with our stakeholders, that communication of and articulation of our risk appetite is as important externally as it is amongst the people who are taking decisions within the organisation, and I think it's important for people to understand that we're not just sitting around waiting to take decisions because we haven't fully articulated this yet, but we're having ongoing discussions about what that articulation looks like, and how that impacts on us in terms of managing some of these risks and doing the business of the organisation. So I just wanted to say thank you for noting that. It's incredibly important that we keep having these conversations in public as well, and seek the views of our stakeholders around that, because it will have an impact on how we do business with people.
No, I absolutely agree, Ruth. Thank you for raising that, and it's a really important point. Okay, anybody else want to come in on this paper? If not, then we'll note, Chris, where we're at in relation to those items. That's really helpful. Thank you. I'll now move to item 6.3, which is the finance report. Just make sure I'm in the right order. Yeah, the finance report. And there's Claire. I'll bring Claire in. Claire, over to you.
Thank you, Chair. So the finance report highlights the financial performance and issues for the period ending the 31st of August 2021. And I'd just like to remind the board that we have two statutory duties, both of which relate to capital and revenue, and we have to function within those resource limits. We also have the 95% requirement for the public sector payment policy, and we also aim to have an efficient use of our cash allocations. So at the end of August, our revenue underspend was 456,000, and our capital underspend was 51,000. Our public sector percentage was 85%, and we had delivered our savings plan. We also saw a slight increase in our cash balances. They were at 7.8 million, and we forecast to Welsh Government that we would predict a break-even position as at the year end. So I'd just like to highlight a couple of key points, if I may. From a revenue performance perspective, as we've already alluded to, we're a new organisation and we're undergoing recruitment and formalising our structures, as Helen highlighted. So we are taking time to recruit to our key vacancies and positions, and that is taking a bit of time. And as a result, we're seeing quite a high vacancy factor or benefit. That said, there are pressure points. So within ICT, this area remains an area of pressure, both in terms of pay and non-pay, and that's really reflected in the data centre and in particular about licensing pressures going forward, although we do expect to cover those for this financial year. In Q3, Q4, we are expecting our vacancies to start filling at a higher rate, and as Michelle already highlighted, we have a workforce task force and we have a recruitment campaign underway this month. So we expect to increase appointments, but we also expect the pressures within ICT to remain. Having said that, we are currently doing a 6-month review of our run rates and we'll be reporting that to Welsh Government in November. From a capital perspective, our capital spend, as predicted, did increase in August, and we expect that to continue to increase throughout the year. Our discretionary spend, which is focused on infrastructure replacement, continues at pace, albeit it was it was slightly behind plan in the month. DPIF spend again is on plan, but is heavily dependent on 3 key areas, which is the digital services for patient and public, the national data resource, and the data intensive care area. Again, those will be closely monitored and they're under review as part of the 6-month review. COVID spend is on plan, but that's very much reflects the Welsh Government allocations, which are payment on pay as you go, for want of a better word. And again, we are, as alluded to, the next 6 months spend will very much weigh on the vaccine rollout and process. As at August, the COVID spend was 1.5 million under. That really is a reflection of the vaccine spend, which was 1 million of that. Again, that was in non-pay and really reflects a reduction in text volumes, as the graphs show you. Equally, if you look at TTP, again, that was underspent, reflecting reductions in licensing volumes. And again, those graphs highlight those in the report. But we have highlighted to Welsh Government that should that trend continue, then there would be a potential reallocation of funds back to Welsh Government of approximately 6 million towards the year end. Having said that, what we have seen in September is an increase in activity in the vaccine. So I suppose the word is we are doing agile accounting in this area and responding to need as and when, and obviously reflecting that in our communication with Welsh Government. If we move on to the Digital Priorities Investment Fund, again, there's a graph detail in the spend by programme. And notably, the top three are the ones where the significant spend falls. And again, those are within the National Data Resource, WCCIS, and the Digital Services for Patient and Public. And again, progress against all of those is monitored on a monthly basis. We do highlight risks and opportunities, but they are dominated by that agile COVID environment. So there are opportunities as well as risks. We review that through the Digital Pathway Group on a monthly basis. And as I said, we will respond as and when those circumstances changes. So what the report also highlights is some additional information, which really reflects the work that's ongoing in finance to lift and shift our ledgers from Velindre. That continues to progress well. And the other point of note is that we have, over the month, developed the renegotiation team ready for the Office 365 contract that terminates next July in 2022. And that will be a joint national approach agreed by Directors of Finance and the Directors of Digital Group. And we will work alongside each other to achieve the best value for money for Wales in that contract renegotiation. Finally, I wanted to highlight the future pipeline of digital priorities. That's in section 9 of the paper. And you can see that there are many items that have been approved or about to be approved by Welsh Government, and there are a number that are under development. Obviously, that will be reflected in our forthcoming planning, IMTP plan. But it's worth note that there are significant pipeline investments ahead of us as DHCW. So I'd ask the board to note the report, and I am willing to take any questions.
Excellent, thank you, Claire, for that overview of where we're at. I think very clear in terms of the current financial position, but also I think very helpfully giving us a pointer in terms of the next phase and what's coming downstream. Colleagues, any questions for Claire in relation to the finance report today? If there aren't, Claire, we will note that, and again, as per the other performance report, next time you come back, it will be the mid-year point, won't it? Finance report. But as you say, I think the important thing from the board's point of view is there's kind of no shocks and horrors in here in terms of finance, which is always nice in terms of working in the NHS and public sector. But as the organisation grows, our sort of financial complexities grow too, don't they? In terms of that. So well done to you and the team, everybody, in terms of people who are managing sort of budgets and projects and so on through the organisation. Excellent. OK, I'm going to move us on. So we've got a couple of agenda items before we close, which are important because they reflect some of the detail work that happens away from the main board in terms of our subcommittee structures and so on. So I'm going to hand over initially to Sian Doyle, who chairs our Digital Governance and Safety Committee. Sian's just going to give us the highlight report from the last meeting, which took place on the 11th of August, I think it was, Sian. So Sian, over to you.
Diolch Mr Cadeirydd, mae'n fraint I fi gael cyfle I roi crynodiad ac adroddiad o'r cyfarfod diwethaf gethon ni, Pwyllgor Llywodraethu a Diogelwch Diogidol ac athi gynnal fel gwedwch chi ar yr 11 o Awst. Before I start the report, I want to thank all the hard work of the team and the contribution they've made into the Digital Governance and Safety Committee. Our second meeting was on the 11th of August and some huge strides were made on the reporting, And as we've always said, and as we express in the meetings, this committee is evolving because it's brand new, but the latest meetings moved us forward quite considerably. So I want to just provide some highlights from the day, because from the meeting. The next meeting, we've agreed as a team that we will start looking at the forward work plan. The last meeting was focused on reporting, and the team are preparing a dashboard so that we can get continuing assurance on the work and the project schedule and its impact on the digital agenda. We had a development meeting as well a few days ago, and some big significant progress was made to develop this dashboard. So I look forward to presenting that at the recent next board and reflect the good work. Just on some of the matters that rose in the committee, we had reviewed and noted the Bwrdd Trust Quality, Safety and Performance Committee meetings, which were provided for completeness. And it was nice to see that Bwrdd Committee thanked DHCW for a comprehensive closure report. As part of the Information Service Assurance Report, we were advised on the work that's been taken to gain accreditation by the UK Statistics Authority under the requirements of the Digital Economy Act. And then this accreditation provides some assurances for DHCW for us to act as a trusted party. We also discussed the shielding. We've talked a bit about COVID today. The shielding patient list was discussed by the committee. Rachel talked about some mitigating action was noted, and the next sort of risk stratification approach will be presented to the next committee. And of course, the NDR work is identified as a real dependency for this solution. The information governance toolkit, we noted this and how this will help us benchmark between DHCW, the health boards, trust and special health authorities. And we supported as a committee the management actions identified within the report, and we agreed to have some updates on the progress, and these will come back to future committee meetings with a view that DHCW led the way as a leader on this information governance piece. Microsoft Office was discussed and the mitigation actions were discussed, and also the learnings, which is great to see from an organisational point of view. And Chris, as our board secretary, talked about putting things right, regulations and the work taking place with Welsh Government to review this and our part within this programme. And as Carwyn talked about, we've discussed a couple of times the data centre transition, and we highlighted quite a lot of the big benefits that would come from this in terms of environmental impact, financially economical for the organisation and the resilience. So, and we've already spoken about that earlier in the meeting. We endorsed the clinical audit and the outcome review. And I'm just coming to the end. As a standing, we talked about the risk management, which Chris has alluded to, and this will be a standing part of our agenda as we deep dive into some key risks. And then in the private part and the closed session, quite a lot focused on the cyber resilience unit, some discussions around the mandatory training around this, and this will obviously be a big part of our agenda going forward. So, and that really is just a quick highlight, Mr. Chairman, of the meeting that we had on the 11th of August.
Thank you, Sian. That's really helpful. There's a lot in there, and as I said in my earlier comment, it's really I think gratifying to see the level and the detail of work which is now going on through our committees, sort of digging down into the detail of what sort of sits beneath some of these things that come through to the board here now. So thank you for that, colleagues. I don't know if there are any questions or comments for Sian in relation to the last meeting of the committee. Okay, I don't think there are. No, I don't think there are. In that case, I will move us on to the final formal item on the agenda today, which is the Local Partnership and Safety Committee report. And I'm going to hand over to Helen, who's the co-chair of that committee with Andrew from staff side, staff organisation. So Helen, it's your turn, I think, it was your turn to chair the meeting and therefore your turn to feedback. So over to you.
Thank you, Bob. Yes, so just a quick update, and yeah, unfortunately Andrew's not around today. And yeah, no, I'm looking forward to sharing the chairing of the local partnership forum with him going forward. So in terms of what we discussed, we agreed and set out our forward work plan for the discussions around the table and finalised our terms of reference. So yeah, we got all the housekeeping out the way, and we noted that Andrew had been appointed as the associate board member. And then we had verbal updates from our trade union colleagues, and one of the changes there that was highlighted is that we're having a change in the Unison full-time officer, sorry. So Darren Dupre has been our full-time officer for the last couple of years, probably 3 years, I think. He's been excellent actually in supporting the staff, and really strong relationships that have been made between kind of our workforce colleagues and the executive team, and Darren is the lead there. So I just want to wish him all the best, really. And we've now had an initial meeting actually as an aside to meet his replacement. And then we just went through the organisational change. So we went through the proposed executive structures. We ran through that. We had an overview of the work that's being taken forward in the application and development and support directorate on product approach, and we had an overview of the risk management report, and reviewed the All Wales secondment policy and noted that, because that had come out. And then we went through some of the workforce stats and some of the update that we'll have been through here through the that you'll have covered in the performance report. But yeah, so the final point was our Assistant Director of Workforce gave us an update on the work with Welsh Government to undertake a workforce review. So we'll be working with the Federation of Informatics Professionals, actually, with Welsh Government to take that piece of work forward. So there was a verbal update on that, and I think that's something that we will come back to around this board table as well, to have an update as that develops over coming months. Thank you, Bob.
Thank you, Helen, for that update report. I think it's a really important group that we have that works between our leadership team and the staff organisations in the organisation. And I'd just like to add, actually, your comment and thanks to Darren Dupre. Helen, I first worked with Darren, I think it was in about 1990. It's a long time ago, 30 odd years ago. He was a new trade union rep in the laundry at Llanfairpwll Grange, Greenvale Laundry. And I was I can't remember if I was the UGM or the chief executive. And Darren first came to the joint management staff committees that we used to run back in those days. And our paths have crossed over ever since, always positively, I have to say. Yeah, I was aware that Darren was moving on to new things. And I'd just like to add my thanks, actually. He's been a fabulous servant to the NHS, and has always represented his members with the utmost integrity. So I'd just like to add to that as well. Okay, thank you. Then well, that takes us to the end of the formal business today. Oh, I was just going to say I've got no any other business, and Ruth just come through with an AOB. Ruth.
Thank you, Bob. I just would like to formally add the thanks of the independent members to you for chairing us and steering us through the last few months. Even in that last item, we very rapidly realised that you have worked with probably quite literally everybody in the NHS in Wales. And now you can add the independent members and board of DHCW to that incredibly long list. So thank you, Bob. You've been personally incredibly supportive to all of us, and you've done a fantastic job for us, helping us and supporting us over the last few months. I don't think you'll ever properly retire. I think this was you coming back from retirement for not the first time, when you saw a challenge or a problem that needed sorting out. So I know that we will see you again in the future, and just want to wish you all the best of luck. And you go with our thanks and love, Bob. Thank you.
Oh. Thank you, Ruth. That's very kind of you. I'm not sure I know absolutely everybody in the NHS, and there's probably quite a lot of people who've joined since I did finish the first time round. But no, that's much appreciated. And just from my point of view, I mean, I sort of said my thanks at the start of the meeting, but I would just like to say a few sort of final words, because it has been an absolute honour to work with you all and to work with the new organisation as it's come through the initial establishment phase and these first 6 months of operation for the new board. And I do have a sense of a lot of progress has been made, not just in the setting up of the organisation, but it's clear from the various reports we've had today that things are moving forward at a pace in terms of delivery, and the board and the organisation is moving into a new phase in terms of the strategic thinking about the future. And also, I think sort of our external relationships are strengthening as well. So I do have that overriding sense of the opportunity. I think somebody else said that today, the opportunity that exists in terms of the future and what digital health and care Wales can do to really help. So again, for me, just to sort of reiterate my thanks to all of you around the board table. You've been fantastic. You've supported me enormously through this period. To the wider senior team, all of the staff across the organisation. I have done a note, I think, to go on. I don't know if it's gone up already, but just a sort of a thank you note that I wanted to put on the web to say thanks to people. But it goes beyond the organisation as well, because we've been greatly supported, I think, over these recent months by colleagues in Welsh Government who have been very supportive around the establishment of the new organisation and will continue to be so, and by all of our wider stakeholders, of course, as well, who I think who have embraced us into the family and are working with us. And finally, just for me, just a special thanks to Helen. She's been an absolute joy to work with, and I know, and I think Simon's still with us on the call. To reiterate what I said to Simon earlier on, and welcoming him and congratulating him to taking on the role. And I'm sure that with Helen and Simon at the helm, the future is very bright for digital health and care Wales. So thank you, everybody. And with that, well, I can't quite close the meeting because I think for the formal record, I just need to note the date of the next meeting. Which, as we said earlier, is actually the 14th of October, and that's the extraordinary meeting for the contract award for Link, assuming everything else has gone smoothly. And then the next meeting, the next formal public board meeting, will be on the 25th of November. Whether I will be sitting there on my sofa at home watching you on the live stream, I'm not sure yet, but I certainly will try and stay in touch, as Ruth has said. I am going on to do some other things, which I think will bring me into contact with DHCW moving forward. So once again, thank you, and my very best wishes for the future.
Thank you, Bob. Best wishes.
Okay, that's it. I'm closing the meeting.